Morning, everyone. If you would please rise and join me for the Pledge of Allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. With that, I will open our first public hearing of the day on House Bill 75. And is the prime sponsor here? House Bill 75. Who are we looking for here? Representative Verville.
This last time.
Kevin?
Thank you, Mr. Chair. I am not the prime sponsor of this bill, but I'm introducing it on his behalf since he is not here today. This bill is a simple legalization bill for cannabis, legalizing it for persons 21 years of age or older, and essentially just removes the language around the Controlled Drug Act, which is in our RSAs. Again, just a simple legalization bill, not getting into the issues of recreational use or sale or anything like that. But I will not take questions since I did not write this bill.
Thank you. Is there anyone wishing to testify on House Bill 75? Well, I guess with that, I will close the public hearing on House Bill 75. And it looks like we have an hour to kill.
What just happened? Nobody showed?
No, Kevin didn't show up. Okay, I'm opening the public hearing on House Bill 190 and invite the sponsor to introduce the bill.
Thank you, Honorable Mr. Chair and committee members. My name is Representative Heath Howard. I represent the towns of Stratford and Barrington in Stratford District 4. Today I'm introducing HB 190, which increases therapeutic cannabis purchase and possession limits from 2 to 4 ounces. This does not legalize cannabis for recreational use. This does not change who can purchase cannabis. This does not change anything other than the fact that people who are already allowed to purchase and possess cannabis for therapeutic and medical use can now purchase and possess more, which really does benefit them from a medical perspective, as some people do need larger doses than others. It helps reduce travel and the number of trips people need to take to the dispensaries, and overall makes it easier for the people who are most in need. So with that, because the language is pretty simple, all it does is change the 2 to the 4. I'm open to any questions. Thank you.
Thank you. I have a question. In crafting this bill, did you talk to any or work with any cannabis patients?
Yes, I'm actually a therapeutic cannabis patient myself. I broke my back when I was 16. I have used it as an alternative to things like opiates. And I personally think that this is a much needed change. It's something where obviously some people, because we only have a limited number of dispensaries in the state, we have 3 companies with only a handful of locations. So it's not exactly always accessible for people. So this way we can help kind of alleviate some of that strain on them.
Okay. So my point, I guess I was getting at is, and maybe this is great that you're a patient yourself. Have you ever utilized 2 ounces in a month?
Personally, no, but again, it's a different differentiates. We need to differentiate between different types of patients,
Sure.
and the thing is that different patients use different amounts, and sometimes they actually will. I mean, they'll buy in bulk, and what they'll do is make oil, which then they can use to cook different types of food, whether it may be a brownie or even something like as basic as salad dressing even. So there are various different types of ways that people can utilize it, and buying in bulk kind of helps reduce some of these people's needs to produce that oil multiple times throughout the year.
So, okay, that's interesting. So the amount of the bulk product you're saying is the weight that they're allowed to have, but
Yes.
that's reduced down when they cook it or do whatever to make something else that they're going to use it for.
Yes.
Okay.
Yeah, that is correct.
And I'm assuming that is pretty potent, though. That
It can be, but it depends again on the different strain, and people will then have to dose themselves accordingly. Like I have a tray of brownies at home, and it's something where depending on what I want for that evening, I'll cut a different size piece, and because it's something that I've had before, I kind of understand what the effect is going to be on me, and so I can kind of adjust accordingly. And so it's something where the patient really is the one kind of taking it upon themselves to self-regulate.
okay. Thank you. Questions from the committee? Representative Muse.
I have heard that it is problematic for some people, the amount of distance that they have to travel. Have you been contacted by people like that? And
Yes.
I mean, is that an issue that comes up a lot?
Yes, it is, especially up in the North Country. I mean, there are, again, only a handful of dispensaries across the state, and a lot of them are in the southern half. It's something where a lot of these patients, especially in the North Country, it's a lot easier if you can cut down the amount of trips that they're making. And, if they only need to come once every 2 months, that's a huge change, because then that's a whole trip that they don't need to take every month, and they can reduce that travel. So
Follow up? Do you see, an analogy that I kind of make in my own mind is I take a cholesterol medication, and one of the things that my pharmacy benefit manager did years and years ago was encourage me to buy a 90-day supply instead of a 30-day supply. And these days I actually pay less for the 90-day supply than I ever did for the 30-day supply. Is there,
Yep.
are we talking about something similar?
Yeah, I mean, again, it's something where whenever I purchase, I always purchase the limit because it is something where, financially speaking, it is a lot more advantageous to purchase the limit. A lot of the times, there are some discounts that are available when you do it that way, and it can reduce the cost significantly.
And one more follow-up. And the cost of therapeutic cannabis is not reimbursed by insurance companies. Is that correct?
That is correct.
Thank you.
With regard to the North Country, are New Hampshire cannabis patients allowed to cross the border to Vermont or Maine and purchase, or would that be a violation of their contract?
So they can cross state lines and purchase in other states around us, so except for Massachusetts. So Vermont, if I'm not mistaken, and Maine, you can go in their medical dispensaries. However, you cannot cross back into New Hampshire with that product. It is locked by state, and you cannot cross because then you would have interstate commerce, and that is federally illegal.
Pretty sure the whole shooting match is federally illegal, but that's further questions. Yes, Representative So.
Thank you for taking my question. With respect to the North Country, years ago, I'm going to say 6 or 8 years ago, there was a major problem with opioids in the North Country, and the reason for that was that people in the North Country couldn't avail themselves to physical therapy. Mm-hmm. So they had to resort to opioids for pain relief. So I'm particularly interested when you said there are very few dispensaries. Do you know where the closest dispensary is up north?
I want to say it's in North Conway, if I'm not mistaken.
Really? Yeah. So if you're in Pittsburgh, or Errol or Colebrook, that's a long trek.
Yes, it is.
Follow up? Pardon me, but for my ignorance on this subject, but recently there's been some talk of a synthetic cannabis called K2 or something like that. Can you explain what that is?
I might not be the best one to explain synthetic cannabinoids. There are other experts here who would be able to answer that better than I.
Okay, thank you.
See no further questions. Thank you.
Thank you.
The chair recognizes the Honorable Tom Mannion.
Thank you, Mr. Chair, members of the committee. You guys asked a lot of really good questions, but I think the prime hit it nail on the head. It's multiple trips ends up becoming a burden on people that are just looking for medical relief, and who doesn't like to buy in bulk. So I'm a big supporter of this bill. I'm also not an expert in this field. I'm not a user. There's people in my family that are, and they may or may not go to Massachusetts to just do it to get around the friggin' hassle. I live on the Mass border, so it's convenient for me. But I hear about these guys up in the North Country and having to drive an hour or something seems absolutely egregious. That's what I got. I'm not sure if I can really answer any questions, but I'm happy to take them.
See no questions. Thank you.
Thank you.
The chair calls the Honorable Sue Homola.
Thank you. Thank you for allowing me to speak on this bill today. I'm here on behalf of SAM New Hampshire, which is a drug prevention group, a national drug prevention group. I'm the state chairman. The issues that we have with HB 190 is expanding the limit of medical marijuana possession from 2 to 4 ounces is a significant increase. And one of the reasons that we keep hearing is so that we can reduce travel time, which is a very noble goal for people who may be suffering in pain. The issue that I have is that we're not actually increasing the number of days that go along with this. If the real goal is to reduce the amount of trips to medical marijuana facilities, then this bill should also come with a lengthening of the days. So if we're doubling the amount of marijuana, then we should double the amount of days in in the state statute. We did hear that sometimes people need additional cannabis and things like that, but right now I haven't seen any data that has been given to anyone on this committee that actually gives hard data on that, as opposed to anecdotal. Sometimes people like to use more cannabis. Many states, to include New Hampshire, like I was saying, they list a frequency for medical marijuana purchases. Overall, the majority of medical marijuana states set their limit at 2.5 ounces or less. That's the majority. There are a sizable handful of legalized states who do it kind of an interesting way. Is they actually do it based off of a 1 month supply or a 30 or a 60-day supply, but they do that with the doctor actually prescribing the amount. So they don't actually put a limit on how much cannabis people say. They say that their doctor has to prescribe an amount, and then they're allowed to have a 1 month or whatever supply. So that's kind of an interesting way to think about that. If that's truly an issue, that might be a novel way to approach that. To determine the depth of the medical marijuana user accessibility in New Hampshire, I really believe that therapeutic cannabis oversight, or the cannabis program, should document the number of users who are significantly affected. And that's all I have to say on this bill. I did want to say, on another note, I won't be able to be here all day, but there are a number of medical marijuana bills that are being heard yesterday. They were heard yesterday in the Health and Human Services Committee. One of the things that is relative for you all is today is I would really request that you look at the totality of all these bills, because yesterday there was a bill that wanted to allow homegrown for medical marijuana. And what you'll hear later today is this: in this homegrown bill, it had no enforcement, no inspection. It was totally on the honor system. It also kind of hamstrung law enforcement in their ability. If they suspect somebody who is growing something illegally, they have a lot of difficulty actually trying to to find out if that person's under the program or not. You'll be hearing later today HB 380, which removes the felony for selling medical marijuana to non-designated individuals. I just want to let you know that yesterday in testimony, one of the things that I heard that why homegrown was a good idea was because, well, we already have these protections in place. We already have this. There's no problem. There's enough deterrence. But you're listening to a bill today that actually is removing that one protection. So I'm just encouraging you, if you could, when you're considering your bills, to look at the totality of it, because Sam, New Hampshire is kind of concerned at the amount of play on to undermine some of the safeguarding law enforcement protections that are in right now for the medical marijuana program. Does anyone have any questions? I'm happy to answer them.
Thank you. Do you or does your organization have any data with regard to the amounts of marijuana that medical patients use? In other words, in the other states, what are they using?
The only data that I have, and I'll send you all the electronic testimony that I have later. The only data that I have is data on what other states do for their medical marijuana program.
What's the highest?
Gosh, the highest is 8 ounces, and I think that's like California or Oregon, one of those two. That was the highest, but for the most part,
and that's in a month.
That's just in general. From what I could tell, they didn't have a time limit on it. It was just sort of a possession. So in most of them, I counted up the number of states who, in the ounces, I did a little chart of like, okay, who has what ounces and things like that. And like I said, the majority, about, I would say 60%, were 2.5 ounces or less. Yesterday, we heard in the Health and Human Services committee, somebody testified that home grow is legal in other states, and it's not. It's not legal in all other states. There's actually kind of caps on that as well. So that if you happen to hear that today, that's not an actual fact.
If you have data that I'd be happy to share
Yes,
with
sir.
the committee.
Yes,
Thank
sir.
you.
Thank you.
Any questions? Representative Scher.
Yes, sir.
Just to follow up on what the chair said, I'd love to see the little chart you did. I
Yes,
think
sir.
that'd be very helpful for the committee.
Great. I will. I'll pass that along.
Thank you.
Thank you.
Thank you. The chair recognizes Heather Marie Brown.
Sorry about that. Representative Knurk unfortunately couldn't be here to join us today, so he did have testimony that he wanted me to turn in for him. So my name is Heather Marie Brown, and I actually am the patient representative for the Therapeutic Cannabis Medical Oversight Board. I also serve as the alternate chair. The reason I'm here today instead of Jerry is because of the fact that he felt, and we all felt, that I could give a better perspective on this, since it is myself and the patient population within the state that this impacts. We are in unanimous support of this bill. We were in support of it before when it had a different number and previously came before you, and we are still in unanimous support of this bill. We have come to realize over the last few years that cost and affordability and accessibility are major hurdles for some of our patients. Also, what we've come to realize, and also myself from personal experience, is that I, as a patient, consume cannabis in multiple ways. There are times throughout the day where it is appropriate for me to sit down and inhale my cannabis through smoking, and there are other times throughout the day where it is inappropriate of me to do so, so I utilize edibles or tinctures or things of that nature. The thing that comes with that is, for myself, I cannot afford to go to the dispensary and to purchase edibles and to purchase tinctures and to purchase the items that I need to carry me throughout the month. But if I was able to purchase 4 ounces of cannabis at one time, I could go home and I can make my butter and I can make my oil and I can make my tinctures, and then I am all set for a month of that, along with what I need for flour. If I follow the law by the letter of it, I have to pick up 2 ounces. I have to wait 10 days to pick up 2 more ounces. There's 20 days of the month. Now, technically, I'm in violation of the law because I have 4 ounces sitting at home. And then I take that 4 ounces, I make my butter, I make my tincture, and I have 30 days worth of what I need to help me get through. I don't think that that's appropriate. I don't think that it's right. I don't think that at any point in time should I have to feel like I'm skirting around the law or violating the law or that I'm a criminal. I fought very long and hard to take control of my health care, and I am extremely proud of where I am today. You watch me walk over here. I'm 47 years old. I'm a mother of 3 children. If I didn't have my therapeutic cannabis, I would already be in a wheelchair. I think that the change in the law is extremely long overdue, and I think that it has many, many benefits to our patients because, again, yes, transportation can be an issue, distance can be an issue, cost and affordability can be an issue, but at the end of the day, it's really on how each individual patient chooses to treat their ailments. For some, it's inhalation. 2 ounces of flour every 10 days may be appropriate. For others, it involves consumption through other means, and it's not appropriate, and we need the larger amounts. I know this is some math, but when I take 4 ounces of cannabis and I go to make oil with it, there technically is only a 30% return on it. So if you're trying to do that with 1 ounce or 2 ounce, you're getting absolutely nothing back, which will mean that you have no sustainable amount to get you any farther than, the 10 days or the 15 days. With the 4 ounces, you have a much greater return, and I'm able to treat my ailments appropriately and for a longer duration of time, therefore saving myself money, saving myself time and travel, and saving, like I said, I have 3 children. So who's going to babysit them while I make a trip off to the dispensary? That doesn't come for free. So I think this bill is something that you should definitely pass and definitely support. And I think that it will decrease a lot of the barriers that some of our patients face these days. And I do know that the Medical Oversight Board has a wonderful relationship with the dispensaries. And, we do annual reports and so forth. And although I don't have those numbers on me, you are more than welcome to get on our website. And we do have annual reports that give you some of the data that you were asking questions about earlier. I also know that if you were to reach out to the dispensaries, that the dispensaries would be more than willing to cooperate and give you answers to some of those questions as well, because really they're the ones that work with the patients and see how much is actually being utilized and distributed, and edibles versus flowers and things like that. So I do hope that you will vote and support this bill and pass it on to the next level. So, because I still should not feel like I am doing something wrong when all I'm trying to do is maintain my health and my ability to be a productive member of society and a contributing member here in New Hampshire. So thank you very much. If you have any questions.
Thank you. About how long will that 4 ounces last you, based on your personal therapy that you need?
For myself, if I can obtain 4 ounces at one time, I'm able to produce enough butter and enough oil and enough tincture that I'm able to get through the month. With that, I do still need the accessibility to the flower as well, because as I said, there are certain times of the day or certain conditions where it's more appropriate for me to use the flower versus the edibles or the tinctures.
Do you find a difference in the level of therapy you receive from the flower versus, for example, the vape cartridges, or do you not use those at all?
I myself do not use the vape cartridges. I've always just kind of been a natural kind of gal. So, I utilize primarily my flower. I have to, where all of our cannabis is tested, there are actually certain profiles that I look for in the cannabis that I select. And that includes when I'm using the cannabis to create edibles and so forth. So.
Further questions? Yes, Representative Newell.
Thank you, Mr. Chair, and thank you for taking my question. I was just wondering, I think it would be enlightening, especially as a therapeutic cannabis patient, to understand a little bit about what is the difference in, can you speak to when it is more appropriate to consume an edible in that form medically?
Mm-hmm. So for certain people, myself included, I suffer from chronic pain. I suffer from PTSD and a few other ailments, but those are the 2 that I received my card for. There are instances where we'll say a panic attack may start setting in. My anxiety may start increasing. At that time, I would utilize a flower to smoke and inhale, because it is a much faster acting way to get it into my system, and it has almost instant effect and helps to bring me back down so I can function. There are times, most of the time I utilize edibles because they take a little bit longer to take effect, but they also last a little bit longer too as well. So I like to view them almost like when you're an asthmatic and you have a rescue inhaler, and then you have your regular medication that you take each day. So that's kind of how I utilize cannabis. So when I, like, say for today, I can't I can't utilize inhalation methods here, no matter how nervous or anxious I am.
Yeah, we would prefer that you didn't do that.
So, it would be completely inappropriate of me to walk outside the State House and light up a blunt and say hallelujah and come back in. But before I left my home, I did make sure that I was able to have a little bit of butter on my toast to make sure that my pain would be under control and to make sure that any of the little butterflies I may or may not have throughout the day are kept at bay. And as you can see, even for somebody that's on cannabis and that just consumed a few hours ago, I'm not wacky. I'm not doing anything disrespectful. I'm normal. I'm functioning. I'm able to walk over here and sit down and, share my experiences with you. And that's not different from any other patient that we have on the program. So all we want to do is be able to take our health into our own control and be able to do what we need to do so that we can be functioning members of society, so that we can interact with everyone and be the best that we possibly can be and change our future outcomes.
Thank you. Appreciate that.
One last question for me. How often would it be that you would actually be driving around with that much product with you, 4 ounces? I mean, that wouldn't be the case, would it?
For me specifically, once a month. I
Just
would
on the way there.
utilize that for once a month. I would go, I would pick up my 4 ounces, I would go home, I would make whatever I needed to make. In 10 days, I would go back to make sure I had flour that I needed for the rest of the month, and I would be okay. It would cut my dispensary trips down over half. I would save money. I would not have to make the decision, do I want to cross the border today? Because yes, that may be illegal, but unfortunately, sometimes our patients are actually driven to that point where they are crossing the border. They are purchasing cannabis in other states and they're risking prosecution and jail time coming back over the border just so they can be able to treat themselves. That shouldn't be a problem, and it shouldn't be, something that we encourage. And unfortunately, unless we increase the possession limits, it's almost like the state is encouraging that type of behavior. And I don't think that's what the state intended to do.
Thank you very much. Oh, yeah, Representative LaSalle.
Thank you for taking my question. And I apologize for my ignorance on this subject, and it might be too personal, but in your case, where you purchase 4 ounces plus per month, how much does that cost you for your medication?
Oh, through the New Hampshire dispensaries, if I have to do it 2 ounces at a time, I am potentially looking at $1,000 or even more.
Per month?
Yes. I am not going to say yes or no, but I am going to say that I am one of those patients that maybe once or twice has been tempted to go through other means and cross state borders just to make sure that I can maintain my level of health needed to be a functioning member, to be there for my children.
Follow up, Mr. Chairman? Cannabis is available outside the dispensaries on the streets.
Mm-hmm.
How much would it cost you if you were able to purchase it that way? Do you have any idea?
I unfortunately do, and it is, pardon my language, a hell of a lot cheaper, unfortunately, through the black market. But as a patient, I know that the black market is unregulated. I know that there is a possibility that I am not getting something that is clean or that is safe or that I should be even putting in my body. So that is not a solution, thankfully, that I have chosen to take. I have thought about it once or twice, but if I'm trying to control my health care and I'm trying to provide the best health that I can for myself, then I need to be very careful of where I do purchase my cannabis. So I choose to purchase it from dispensaries and reputable sources that I know my medication is being tested. I know that what I'm receiving is clean, and I know that I'm not going to get sick from it.
One more follow-up. You said with respect to on the street, you said it's a heck of a lot cheaper. So versus $1,000, just in an average, what would that level of dosage cost you on the street? Half or?
Well, let's just say that there are opportunities available in this state and in other states for that kind of transaction to happen. And you are literally looking at pennies on the dollar. So, what an ounce would cost here in New Hampshire can, in some instances, acquire a half a pound in another area, in another state, in another market.
So 1/8 would be?
So I'm talking about a half a pound versus the cost of an ounce. An ounce is 28 grams.
We'll just stick with a heck of a lot cheaper. Okay.
Yes.
Thank you very much for your testimony.
For the uninformed, like myself, it seems like there are very few dispensaries, and I see other retail places that advertise CBD. What is that all about?
So CBD can be derived in many different fashions. The CBD that you see advertised that's available at the gas station or the health food store or anything like that, that is derived from the hemp plant, which the federal farm bill protects, which New Hampshire says is okay to do. So those facilities are able to get hemp-derived CBD and sell them in their locations and give them to people. I am definitely not saying that there is anything wrong with that, because there's not. Sometimes that's what a person needs, but most patients rely on what we call the entourage effect, and that is where CBD, THC, and every other cannabinoid that's in the plant works together. So it's not always necessarily best for us to utilize only one cannabinoid, but in some cases it is. So the difference between hemp-derived and between medicinal CBD that has actually come from a plant that contains THC is basically the THC amount within the plant. I think it's 3%. It's 0.3% for in order for the plant to be considered hemp. In the medicinal world, the dispensaries, when they grow a CBD strain, it usually does not meet the hemp standard, and because it has a little higher concentration of the THC and the other cannabinoids, but that is absolutely wonderful. And again, that's where the entourage effect comes in, and it's available for more people to be able to utilize.
Thank you.
It's basically like comparing Heffenreffer to O'Doul's. It's one's got no alcohol.
Well, I know about the relationship there, so that's that analogy is good. But then, so how would that work with the comparison between CBD and hemp product? Like, there's a big difference between recreational marijuana and CBD.
Yeah,
And
CBD has
then
no
there is some
hallucinogenic effect.
relationship between CBD and hemp.
Yeah.
So would that be as great for both of them? Or?
No, the one that you would get at like a convenience store, it's my understanding it's like one ingredient of the hemp plant, the part that doesn't have the hallucinogenic effect or the pain killing effect. It's more of it's considered more of like a supplement type thing.
But in all of the products, you get it from that combination.
Yes, right. It's
Yeah, but the combination has very small quantities of some of it, and it has larger quantity of the
Right,
CBD.
correct,
Okay,
correct.
thank you.
no further questions. Thank you.
If it's all right, I just would like to say thank you so much, and I do appreciate the questions. I think that this is an opportunity for all of us to be able to learn something new, and so I thank you for your open-mindedness.
Thank you. The chair calls the Honorable Joe Hannon.
Good morning. Thank you for listening to us today. My name is Joe Hannon. I'm a former state rep. I was also the public member on the 2018 Commission to Study Legalization and Taxation of Marijuana, they called it at the time. And I'm also on the advisory board for the New Hampshire Cannabis Association. I'm in favor of this bill. I'm not going to go into too many of the reasons we heard because we've heard about the travel times. And, you know, I think most of us have a Costco card or a BJ's Club card, so we understand buying in bulk saves money. But I don't think some of us realize, some may. I realized this in the last few years, how difficult it is for some people just to leave the house sometimes because of their medical conditions. You know, I had a cousin who was agoraphobic, you know, with fear of public places going on. My dad thought it was agoraphobic. I'm like, it's not sweaters. It's, she didn't want to go outside. But I had severe back pain and I wasn't able to leave. I was able to, but it was extremely difficult for me. I actually went out and bought 5 pairs of sandals because I couldn't tie my shoes for a while. Driving was extremely difficult. I just had to drop my son back off of college and it was a 4-hour drive each way. And I'm much better now, but it was a very difficult thing for a seemingly healthy young person to do. You know, someone who has a chronic pain condition or other chronic illnesses like cancer or, you know, and any other person who might be in hospice care, leaving the house is not an option. And if it is, it's going to be very planned, very focused. And it's much a bigger deal than people think. Also, we heard from, you know, people like Heather, they need to make their tinctures or edibles. We don't want people to smoke more necessarily from a harm reduction standpoint. It's, you know, the preferred way of most, it's easy. People get it. They know what they're getting right away. But sometimes it's better to make edibles for all kinds of reasons. And also, we don't want people on the roads as much. You know, we want people to drive, you know, we don't want people using substances and being on the roads. And most people are trying not to do that. But I guarantee there's going to be a percentage of people who drive to the liquor store a little too buzzed or drive to the cannabis store a little too under the influence. It happens. We want to minimize that effect by not having them just drive an hour to these stores or driving out of state. They're not going to stop using it if it's really necessary and they're able to get out of the house. They're going to go to some other store. If it's that cheap on the streets, we don't want to push people towards the streets. So if we want to combat the black market, keep people safe on the roads, protect our environment, not waste money, not waste gas, not waste our time, not suffer, and not prohibit people who have a medical problem. This is not recreational, like we've heard a million times. If you want recreational, you can go to the state liquor store and fill up a tractor trailer full of whiskey. That's fine. But a medical patient has to have a certain amount and not more because that's bad for whatever. I don't know what they're really, it doesn't make sense. This is something that we've admitted as a medication. People need it. It changes lives. It drastically transforms many people's lives. And if someone needs that much of it, it's absolutely necessary for them to get it. I've also, last point I'll make, well, not the last one, but the second to last. I've done a lot of time in other disaster zones, and I've seen what happens when natural disasters occur. I'm not I don't have a bunker in my backyard. I don't have 2 years worth of beets in a barrel, but I prepare myself for when the power goes out for snow emergencies or disasters. I've lived in Florida. I've survived many hurricanes. I was in Katrina for 5 weeks working with police officers. And I noticed, not to notice, but it was blaring. One of the biggest problems you can hear about in a disaster, and I'm sure it's happening in LA right now. All these officers and firefighters, they might not be able to have access to their medications. I'm not talking about cannabis, but just in general, they might not have access to their medications. So if someone's up north, I get snowed in on the seacoast. You don't think they get snowed in more up north and don't want to go on the roads? I don't like driving at night. I'm pretty young. My eyes aren't that bad yet. But, you know, you don't want people to go out. The sun goes down at 3:30. It's pitch black. It's cold and they're in pain. You want to make people go out more often. I get annoyed because I have to drive, 4 miles to get Chinese food where I live. You don't want people to have to be in that situation. And as far as last thing, we heard an illusion. They mentioned the other committees and bills, and I don't like to do this. I know it's not allowed, but since it happened, I figured it would be okay. Yeah, thanks. Appreciate it. About no regulation for home grow. And you're going to hear this, and it's relative to this because if people were able to grow it at home, they wouldn't need as much at the store. And most people aren't going to do it. It's very difficult. I wouldn't plan on it. I can barely keep a cactus alive, but you can brew 200 gallons of beer or wine if you have 2 adults in the house over 21. That's about a 6-pack a day. And no regulation, no oversight. When we were on the commission and we asked the Liquor Commission if they do anything about it, they kind of looked at us like, well, no, it's just home brew. No one cares. It's not a problem. There's no big operations going on. But if there were, people would be getting better. These plants are going to be coming from stores or known growers, so there's going to be a known strain or quantity of cannabis. If it's going to be diverted, and we'll get to that later in the penalty bills for people in the program, but they're getting something that's not corrupted with other drugs or adulterated. So I don't recommend it. I don't think it should be done. But if it's going to happen, I'd rather someone get it from their grandfather or grandmother and not get it from the street. So there's a lot of reasons why people have limited drug quantities in the past, and some of them are for safety, the number one. Now, public safety aside, they're mostly for personal safety. Like, we don't want to give someone an amount that they can easily die from an overdose. But most medications that are prescribed, a 30-day supply can kill most people. I can list probably 100 drugs off the top of my head that'll probably kill you if you take a 30-day supply, and they give it out like nothing. So is it to limit other people getting it? I don't know how effective it really is, but it's definitely cheaper. I would definitely buy in bulk if I could do it. I know before COVID, who bought toilet paper in huge bulk? So it's hypocritical for me not to say that people should be allowed to prepare themselves and not be in a position where they're meant to suffer because of an unjust law. Be happy to take any questions.
Thank you.
Except K2. I just thought that was a mountain.
2 ounces.
Yeah.
So for me, that sounds like a real lot. Is it? Could you give us I mean, I know it's kind of this ethereal thing, like how much for each patient. I'm going back to the high school days with the bag. I mean, how 2 ounces? How much is that? That sounds like a lot.
I mean, I haven't seen it. I haven't sat down with a 2 ounce bag since college, but
Well, it was a lot, right?
It was quite a bit.
Yeah.
And I actually asked several people because I don't smoke. And the question is, is it a lot? It varies. I prescribed opiates to people in my practice very sparingly. Since I was someone in long-term recovery, I was very hesitant to do so. So I was one of those people who was very cautious about, and this is back when everyone was just handing them out. And even now, I'd probably do less than I did as far as prescribing. But I see people that would come in on a daily basis with enough opiates in their system that could kill 3 people.
Yeah.
And they take them like it's nothing, and they're functioning. I have a friend who's in end of life care right now, and she's taking enough opiates, and she's been driving for 20 years like this. Yeah. She's absolutely, fine.
So
appearing. Tolerance builds up. I'm not saying that, I don't want to get into the debate about what we should be allowed to drive with under opiates and things, but it's happening, whether we know it or not. But I think it's important to say that, is 2 ounces a lot? Someone who's taking enough opiates to kill a large farm animal, that's nothing. But the opiates have a lethal dose. All drugs have and real quick medical background. You won't hear this a lot, but LD50 is a lethal dose 50. That means what dosage a certain drug has to be to kill about half the people. So half the people will live, maybe not doing well, but half the people will probably die at that dose. Every drug that's prescribed has that dose. I don't know offhand what the lethal dose for cannabis is in studies because there haven't been any. It's actually, you can't overdose on it. You can get sick, you can get, all kinds of weird feelings, but no one's going to die from it unless it actually falls. Now, if we let them have enough that it could fall on their head, like a bale of it landing on someone's head from a barn, yes, that is a lethal dose of cannabis. So if you want to know how much cannabis will kill you, it's probably the size of a bale of hay from a height, because I could probably hold that on my head. So it's got to be from a height. But, is that too much? I would think it would be an awful lot, but for someone with chronic pain or a chronic opiate problem, might not be that much at all. I know people that do 1,000 milligrams of tinctures or edibles a month, and that's a lot. But to get that much flower to make a tincture or edibles on your own, you'd need more. And I'd rather see people doing that than getting opiates or other far more dangerous prescription drugs or non-prescription drugs from the street, whatever, I don't know, K2 or whatever it is. And cost is an issue. So thank you for the question. And sorry for the long answer.
No, thank you. The tolerance thing was actually a good point.
Good.
Further questions? Yes, Representative Newman.
Back to the questions I was talking about before, and the analogy between regular beer and O'Doul's. So you have some THC in the medical marijuana, and you have some in the plant, more obviously. And if you were drinking beer, you could get a buzz on, but to get the same buzz with the non-alcoholic beer, you'd probably have to drink a case. Is there the same kind of analogy like that between?
I am an expert on the subject. I stopped drinking many years ago, but I was a pretty bad drinker. It's, people that drink non-alcoholic beers, I see some people in recovery that just don't want to go near it.
Right.
And I know some that do drink it. And those that do don't think twice, especially when it's zero. There are O'Doul's, when it originally came out, I think it was 0.5%.
Right.
So you'd have to drink, 12 to get the equivalent of one beer on average. One beer does not get too many people I know even mildly buzzed, but to get 2 beers, you have to drink a case.
Yeah.
Or is that right? No,
No.
12 pack. They could, but it's just a matter of how big your stomach is. I mean, you have to drink if you can, the average stomach can expand to about a gallon. More with training. It's another discussion, but I can eat a lot of chicken nuggets. But anyway, so yeah, I don't think that you're going to get that problem. Now, people can buy. Your question, I think, was earlier about CBD.
Yeah.
Now, it's the non-psychoactive, one of the many non-psychoactive parts of the cannabis plant. And just the percentage doesn't mean that, hemp plants and true cannabis plants don't necessarily, they have both, but the percentages are much lower. So the cannabis plants that are being made, grown now, much higher percentages of THC. They still have CBD in them, but that's not as I wouldn't say readily available. It's not the prime reason why some people are using it. Now, you heard someone talk about the entourage effect. When you take CBD with different kinds now there's multiple kinds of CBD, and I'd love to talk to you about that, but I'm sure we could do that in the hallway because that'll take a lot longer. But when you take THC, the psychoactive chemical in cannabis, with CBD and other CBD, CBN, and some others, you can often have different effects, and sometimes they're better. And a lot of people find, CBD is good for different conditions, but to a certain point. So the dose is important for a lot of, for any drug. The dose, and then also the poison is in the dose. Like I said, if you take too much, it's poisonous. Like water, if you have too much, it will kill you. So we should limit. Swimming pools are deadly, but we can have as much as we want in a swimming pool. But it can kill people. It's one of the number one killers of young children under the age of 5. So CBD can have hemp-derived products can have THC in it, but it's a very small amount. You won't necessarily get high from it or have any effects. But if you take enough of them, you could. I've seen people get an edible container with maybe 30 CBD chewies or whatever, gummies or whatever in it, and I think a standard dose of them is 30 milligrams of CBD or maybe more. Some are 60, but 30, to throw that number out there, there might be 30 of CBD in it. And to have 0.03%, there might be 1 milligram of THC. Now, that does have THC, and it would be illegal if it came from a cannabis plant. But if it came from a hemp plant where the whole thing only has 0.3%, we're talking about flower. So edibles, they can change it, but it's not illegal. And you're probably not, you'd have to take the whole, you can get 30 milligrams, which is quite a large amount of THC for a new individual who hasn't done it before. But you have to take 30 of them. And it can be cross prohibitive. They charge the same amount for a gummy with CBD and 1 milligram of THC that's hemp derived as they might do for an edible with a lot more THC. So to get the same effect, you have to buy the equivalent of a case of O'Doul's or more to get a little bit out of it, and it's not worth it. You're going to feel other effects. I'd love to eat a bag of candy, but I'm going to get other problems from that.
Thank you.
Sure.
Yes. Again, I apologize for my ignorance here, but one of the things that makes fentanyl so such a big deal is compared to heroin, it's much less expensive.
It's well, fentanyl is not only usually cheaper, it's easier to smuggle. You know, instead of having to bring this much in, you can just bring in this
Yeah.
much. It's more lethal, and it's harder to titrate something like that. You can't, when you take a medicine, if you're taking cannabis with tinctures, you have an eyedropper. You can say, okay, I need 3 drops or half of a milliliter or whatever you're taking. You can cut a gummy in half if you only need a certain amount. But if you're doing fentanyl and they shoot it up, and I worked with syringe programs for a long time, I helped get a lot of those started. If you have a syringe and you pull it up with fentanyl in it, you know, there might be this much in the syringe and you might push that much into your vein. Not you, but, you know, put that much in, most of the fentanyl might be in that last half. You know, so if you chop something up, it might be, it's not all fentanyl. And if you get pure heroin, you know what you're getting. Like back many years ago, I worked in a hospital in a very high heroin area, prevalent area. People would go out and say, oh, someone died of an overdose. We want that because it was the pure heroin. It wasn't cut up, because people would take it and not know what they were taking. You know, people overdose when they don't know how much they're taking often.
Follow up?
Yeah, sorry.
Mr. Chairman.
Sorry if I'm ignorant too.
The reason I ask
Yep.
is that obviously cost is an issue. And it's my understanding, and again, I'm rather elementary here, but K2 is a synthetic form of cannabis.
Yes.
If they're able to produce K2 much cheaper than the natural form of cannabis, would that take some of the bite out of the cost of therapy?
I don't know a lot about the pharmacology of K2, so I don't really feel confident to speak on it. I don't know why someone would get. I don't know why someone would do that. I mean, I understand that other than cost, and you know, we've heard people testify for, and especially we're talking about medical right here. People in the medical program they're paying a premium and still going to the dispensaries, and not that they're way higher prices. They're you know, competitive to a degree, but it is cheaper when you can buy other products. Now, since the people in the medical program are not looking for K2, they will probably not use that unless it's just to try it out for whatever reason. It's so much easier just to go somewhere else if that's the case. We're surrounded by states. It is not a problem when in the commission, when we heard testimony, all the prevention groups, they brought all the kids in talking about how it's so prevalent, it's everywhere. And I don't disagree. It's very prevalent for young kids to get. It was harder for them to get alcohol. Especially I have a freshman in college son, and it's much easier for them to get, you know, cannabis than alcohol sometimes. And well, not when he got to college, it's a little easier to get alcohol, but in high school. So I don't think that's who's going to buy stuff like that, or more likely to get it at the gas station, is someone who can't go in a dispensary with it because they're 21. So people that are using that are probably under 21, or, you know, just don't have any money at all. And we're talking very, very, you know, low on funds to try that over something that's the real thing. It's a good question, but I don't think it's relevant to medical.
Thank you for your testimony. Well said.
Thank you.
This last one. Matt Simon, the chair calls.
Thank you, Mr. Chairman. For the record, my name is Matt Simon. I work for Granite Leaf Cannabis. We're a nonprofit therapeutic cannabis alternative treatment center. We have a production facility located in Peterborough, New Hampshire. We operate 2 dispensaries, one in Merrimack, one in Chichester, and we support this bill for the reasons you've already heard, and I will elaborate a little bit on a couple things. The main reason is what you've already heard from Heather Marie Brown. Most of the patients that visit our dispensary do not buy the limit, but we do realize that therapeutic cannabis is very individual. Different patients have very different needs, and as you heard, a small subset of our patient population needs a lot more than the average person. So it is to accommodate those individuals, particularly if they live in outlying areas. We have 7 dispensaries in the state. There's one in Conway, there's one in Plymouth. So the North Country in particular is quite some distance. So it would help that patient population most dramatically. It would also help all of our patients, because one of the confusing aspects of our program is that we have to track patients' allotment. When the bill originally passed in 2013, it was assumed that cannabis flower would be the product. Now it's a wide range of things, from, brownies, tinctures, edibles. We make capsules, we make suppositories, vape cartridges, really a lot of things. And 2 ounces is a flower amount. So for every product we make, there is a corresponding amount that translates to in flour. And so we have to do math, and patients are often extremely confused about how much of their allotment they have left, how much they can continue to purchase. Usually they're way below the 2 ounces, but it's hard for them to understand that, and our staff has to spend a lot of time explaining to them. And frankly, I wouldn't be able to explain it very well because I don't understand it very well. So it would ease a lot of confusion around what patients can buy and can't buy at any given time. We heard the 10-day limit as an issue, so I support the bill as it's currently written. If that's the sticking point, I think there might be a potential compromise if the bill was amended to 4 ounces every 15 or 20 days, something like that. It would help the patients who live in, say, Pittsburgh, if they could. They're not trying to come every 10 days. So that might be a potential compromise. I haven't discussed that with the prime sponsor or with any stakeholders, but it would be better than not passing this bill, in my opinion. On to a few other topics that have been raised, if I may. So the price of cannabis, it is more expensive in New Hampshire for a number of reasons. We discussed some of those reasons in committee yesterday. There are a few bills that would help us bring those prices down. I will say we have brought prices down considerably. Our leadership team's been in place for 3.5 years at Granite Leaf. When we took charge, all 1/8 ounces of cannabis in New Hampshire were $55 an eighth, which was exorbitant. And just earlier this week, we reduced flower prices for the 3rd time. They're now down somewhere between 30 and 40% overall from where we started. Currently, most of our flour is $199 for an ounce. So it'd be 5 ounces under 1,000. And some of our flour is in a little higher tier, so it's $239 an ounce. Those prices are all on our website. And if you're curious about the prices, I just encourage you to look at the ATC's websites. Everything we have is listed, and also look at neighboring states and see what cannabis is selling for in both the adult use and medical markets. I do this research all the time because it's part of my job. But basically, we're working very hard to lower prices, and every time we're able to lower prices a little bit due to market factors in neighboring states, they've lowered them even more. So the expectations continually change, and we're always trying to play catch up and never quite succeeding, but we are trying. Synthetic cannabinoids is a huge issue I've been working on for a long time. We want patients to have access to natural cannabis. Cannabis is the scientific name for the plant. The plant doesn't know whether it's hemp or quote unquote marijuana. Hemp is a legal definition that arbitrarily says any cannabis plant that is less than 0.3% THC by dry weight is hemp, and any other cannabis plant that has more THC than that is not hemp. So when the Farm Bill passed in 2018, this whole game changed. Prior to that, we were hearing a lot about spice and K2, which are not cannabis at all. Spice and K2 are fake cannabis. They are different types of plant material that are sprayed with synthetic chemicals that are designed to resemble cannabinoids. They aren't even actually cannabinoids. So that stuff was awful. And we worked hard to get it out of the convenience stores. There was a study commission 10 years ago that I worked with, and ultimately prohibited those products. Then hemp became federally legal, and we're in round 2 of this now, because since the federal government has not regulated hemp production, has not regulated CBD markets, has not stepped in to regulate any of this, it's all fallen on the states to regulate. Some states aren't regulating at all, so we have a massive hemp-derived market in cannabinoids like CBD. I think any analogy to alcohol fails, because alcoholic beverages, there's one molecule that's active, it's ethanol. We're all pretty familiar with that one. Cannabis has over 100 potentially cannabinoids in it. THC is the one that is intoxicating or potentially intoxicating. There are over 100 non-intoxicating cannabinoids that are increasingly the focus of research. And they can all be produced from hemp, and they are being produced from hemp. And there's a massive unregulated market for these products. There's also hemp companies that are realizing they can make more money by synthesizing THC products from hemp. And that's where we run into trouble. And New Hampshire has prohibited that. Last 2 sessions ago, passed a law to prohibit hemp-derived synthetic THC products, and last year eliminated the sunset on that bill. So they're illegal to sell in New Hampshire, but they are still very much available, and that's a whole nother messy federal issue that may or may not be addressed in this year's Farm Bill, and I'll certainly be tracking that. But back to this bill, we're trying to help patients here. We serve, there are a little over 15,000 patients currently registered for the therapeutic cannabis program. We're trying to make life as okay as possible for them, and this bill would do that. So ask you to pass it. Happy to answer any questions.
Thank you. As you said, you represent one of the 8 stores. I have a question. Have you ever been visited by, or anyone from the federal government, like the, for example, the ATF or anyone
Nope.
like that? Do you keep on hand records that, were they to show up, that would show patient names that had been there, that are purchasing things there?
If federal agents showed up at our facility,
Yeah. Keeping in mind, I mean, it is
Yeah.
illegal federally, so the ATF
Correct.
could theoretically show up. Do you maintain records there that they could use to trace back to patients in our state?
we do maintain those records. I don't think we would be very interested in sharing them with federal agents. So it's interesting. The therapeutic cannabis law includes a specific prohibition. The Department of Health and Human Services cannot share patient information with the ATF. If they showed up at DHHS, they're not allowed to do it.
Right.
Nobody's ever asked what, I think we would want a court order. Obviously, we're not going to just hand over
I'm concerned
patients'
about,
patients'
because we have a
information.
lot of veterans that
Absolutely.
that take advantage of this product to help them with their PTSD, and many of them I don't think realize that were the ATF to show up with a subpoena, you would not have much of a choice but to turn over those records. I mean, you may go into court, but I would say it would probably be a losing proposition. So I'm interested in somehow shielding that information.
I appreciate the question, and I'm interested in shielding patients from any potential negative legal consequences. Our law is tighter than most on this. Some states allow that kind of sharing with federal agents. We've explicitly prohibited, and that was the main reason for that.
Yeah.
But yeah, we would fight in court to prevent anything like that from happening. And I'm heartened by the fact that it has not happened at all anywhere.
Yeah.
That this is prosecutions for, for example, the firearm issue have been very, very few and far between and very selective. And there have actually been a number of court rulings that call the entire constitutionality of that prohibition into question. So
Yeah.
I'm somewhat hopeful that that will change, not because I think Congress is particularly functional, but because I think the court decisions are going in the direction that some court is going to throw that out. And say that as long as you're not impaired at the time, there's no reason why somebody who happens to consume or possess cannabis should be prohibited from owning a firearm.
Well, as often is the case with our federal friends, it would come down to what did you put on a form, a piece of paper, when they go to purchase a firearm.
Right.
It's got nothing to do with whether they're actually using it or not. It's what they put on that form.
I would agree. Yeah, there's a big gap between how the ATF interprets federal law and applies it to that form and what a number of courts across the country have said on this issue when it's actually come up. So.
Thank you. Well, I may reach out to you after to discuss.
Certainly.
that. Thank you. Any further questions? Yes, Representative Newman.
Yeah, just in the very beginning of your testimony, you said, I don't know whether it was not for profit or a nonprofit.
The New Hampshire Alternative Treatment Centers are required to be organized as nonprofits at the state level. We are not recognized as nonprofits by the federal government, so that puts us in an odd state of limbo. There's another bill in another committee on that.
Thank you.
Representative Scher.
Thank you, Mr. Chair. Just for your information, for the chair's information, to show up with the ATF would have to show up to get the names of people. They would have to show up with a search warrant. To get the search warrant, they would need to have probable cause to believe there was evidence of a crime in the names they were seeking. So it couldn't be a general, hey, let's get these names and see what we can come up with. It would have to be targeted at a specific person or persons for whom they have probable cause to believe is committing a crime. Just
I would posit that a store that has a big sign out front that says we sell marijuana is probable cause that there's a federal crime happening because it's illegal federally.
it would be
I mean, it would stretch and it would go to court, but
well, yeah, we sell marijuana. There'd be probable cause to search the place, but not for the names. It would just to information about the owners, and
it would be necessary.
yeah, it would be.
If I may, we do have limited protection from federal enforcement. It's about the most limited form you can have in the form of a budget amendment that's been approved as part of the last several federal budgets. It simply prohibits federal agencies from spending money to undermine state cannabis laws. Okay. So I would have to fight them in court over that too. There'd be a lot of fights going on, but I don't anticipate. I think you're right that it would be targeted towards one individual. In the unlikely event that the feds showed up at our dispensary, they would not be trying to access our entire records. I think that ship has sailed, and the federal government has moved on to other priorities. Rightly so.
Thank you. With that, we're all set.
Thank you all.
With that, is there anyone else who hasn't testified in this bill that wishes to testify? Seeing none, I'm going to close the public hearing on House Bill 196? 190, and I open the public hearing on House Bill 196. And I invite the prime sponsor to introduce the bill. You're in place of the entire bill?
That is correct, Mr. Chairman. I'll be speaking to the amendment.
Okay. John, you didn't fill out a pink card? Wow. You've been gone too long, apparently.
Oh, my apologies. My apologies. I was running around trying to get the amendment. I forgot to sign up to speak. I'll do that afterwards if that's okay. I'm just waiting for the amendment to go around just so I can. Thank you very much, Mr. Chairman, members of the Criminal Justice and Public Safety Committee, Ranking Member Gothright, Representative Rhodes. For some reason, this room feels very familiar. I don't quite know why, but it's always good to be back here. And the amendment that I brought forward to you today, thank you for taking the time to read it. I apologize for that. I was hopeful that my amended amendment would be in time for me to email the committee last night, but it wasn't. So I waited for this morning in time for me to be able to mark it and go up to HCS and produce some copies with what the amended amendment will be. Unfortunately, not an error of OLS, but an error of mine. There was on line 25 a missed word where it reads expunged. It should say annulled, but I've marked that on each of your sheets. HB 196 was brought forward before the legislature last term by myself, and we had in this committee had some pretty thorough conversations about what the legislation was about and moving it forward to the House floor. Representative Rhodes, you and I had a really good debate on the House floor about it. Always. And the legislation itself, what it does is allow people and initiate the Department of Safety to annul the crime of anyone who has a possession misdemeanor or violation level possession charge for cannabis offenses. The point behind the legislation is similar to what the spirit behind Governor Sununu's decriminalization law and its annulment provision was, which is the state is moving forward on this issue as other states have. I like to use the example of Colorado and Washington, other states that moved forward and allowed people to smoke, sell, and use this drug, but kept the record of people who had been arrested prior on their record. And what that did was stop them from get loans or get a job or with the federal government or other programs which restrict people from getting that job if they have such a charge on their record. These are people that have served their sentence, done the time, come out, and now the charge that they were incarcerated for is no longer being prosecuted, but they're still unable to get forward in life, which is the point of the criminal justice system, the rehabilitation side of it, because this charge is still on their record. So this legislation changed from the original version of HB 196 would authorize the Department of Safety over the course of the next 18 months after passage to go through and expunge the records of anyone who has a misdemeanor or possession violation level possession offense for cannabis. It also allows for people, if they are missed in that 18 months, to petition the court to get an annulment. It doesn't allow for anyone who's currently serving a sentence get their annulment, or anyone who's about to be convicted to not be convicted. It doesn't allow for anyone who has any other charge other than the misdemeanor violation offense on their record to have that annulled. And if you're petitioning for your annulment, but you have, but the conviction of a misdemeanor charge included other charges, if you were arrested for selling, but it also included misdemeanor possession, et cetera, you would not be eligible for annulment. This is only for people that were arrested for violation level and misdemeanor cannabis offenses. Currently, with the annulment statute as it is, where people can petition the court, nobody has gone forward and petitioned the court. A group of lawyers have sought people to ask if they have under the current law, because you can, as I said in the beginning, under the current law, but they don't. And we've seen in states where this is implemented that people don't go forward because the form is cumbersome. We had testimony from lawyers who are working on this issue who said that when they looked at the form that their eyes glazed over because it was such a cumbersome form. And I imagine that I can't imagine that it would be easy for somebody that doesn't have the background and experience that a lawyer does to look at that form and to seek an annulment. So what this process does is make it a proactive process for annulments and allow people the opportunity to petition the court if they feel like they've been missed from that proactive process. There are 12 states that have implemented legislation such as Oklahoma and Utah that goes much beyond this. They call it clean slate laws, where essentially it's much more thorough wipe of people's records. That is not what we're doing here. This is a very simple proactive measure on one specific, the misdemeanor or violation offenses for cannabis possession over the course of people's lifetime. Right now, we're not necessarily prosecuting those offenses. We heard that in testimony last year, but people still do have it on their record from when the state was prosecuting these. So I think it's good if someone has shown that they've gone through the criminal justice system, they've served their time, to allow them to move forward in life, get their job, get their loan, and have their record expunged for this crime, which the state is no longer prosecuting in this way that is outlined in the bill before you here today. So thank you very much for your time, Mr. Chairman, and I'm happy to take any questions that the committee might have.
Thank you. I don't see a fiscal note on this, but yet it mandates the Department of Safety to go back and go through all these records. Did you have, or did anyone reach out to you to say, hey, that might cost some money? Did you hear anything?
Well, no doubt will cost some money, I think. I would imagine there would be a fiscal note
I would think
eventually. This is the amendment as
Does
it
the
was just.
original have the fiscal, does that, anyone have the original? Does it have a fiscal note? Indeterminable. Okay. It's not a good thing. Yeah, go ahead. All right, thank you. I was curious because it seems to me that it could be labor intensive for them to have to go back through and to figure. I don't even know if they have a way to do that. To search by who has been or has such a thing on their record. Did you reach out to the Department of Safety at all to ask about what the procedure would look like to kind of do this?
The Department of Safety and I had conversations last year, or in 2024 last year, but we haven't had conversations on this bill about the specifics. I would say that given the number of these charges, that I wouldn't say that there would be thousands of these charges that they would have to go through to look at. I wouldn't say it's extraordinarily labor intensive, and I would be open to any amendment that the committee has around changing some of those staffing.
I'm just more curious as to whether or not they have the technology to I mean, I've seen some things that are kind of scary. I don't know if they have systems that are linked or how they would be able to go do that. So we'll reach out to somebody from safety. Thank you. Representative Rhodes, you had a question?
Thank you, Mr. Chairman. Thank you, Representative. I don't know if I'm looking at this wrong because it was just a real quick look over here, but there's a like basically a page 2 on the back, but it says about, hold on, I might be looking at, it says prior to January 25. I was thinking it was supposed to take effect, but that was getting butt. Carry on.
Okay.
Question withdrawn. Anyone else? Representative Murray.
Thank you, Mr. Chair, and thank you for taking my question. I recently had some friends of mine who were accepted to an apartment, and then the landlord withdrew his offer after finding out that 10 years ago, one of them had been charged with possession while he was in college. And those charges were later dropped and he was found not guilty, but then it came up on the background report. And so the landlord withdrew the offer to move into this apartment.
Would you believe that?
Well, I'm asking more like, do you think that this bill would address that / like that annulment clears the record enough that those kind of situations wouldn't happen? Because I know annulment will still leave something available on some records. You know what I mean?
I can't speak to that specific case, but that's what I would say is the generalities of that case is why I'm bringing forward this legislation, because you have situations where people, but I'm, you know, in doing this legislation, I was thinking more of people in my mother's generation, but it's definitely college kids that were just there as well. But people from, you know, the 80s and the 90s, when this state was prosecuting this drug a little bit more intensely, a lot of it more intensely, that it's people go through situations like that. Oh, I'm not able to get my apartment. I'm not able to get my loan. I'm not able to get the job that I'm more than qualified for, and they're looking forward to me being a part of. I've heard anecdotes about that. What I would say is the annulment, I think, would solve that situation. There would be things left. There'd be a way to look at past records, or, you know, you can't annul a newspaper article, you know, but I think the fact that the court had come and said this is annulled, it gives that person the ability to go to that landlord or the boss at the job that they're looking for, or the bank, and say, yes, this did happen, but I took the proactive step and the state assisted in getting me this annulment, so that I have shown that I've been rehabilitated and I'm looking to move forward in life as a citizen participating in this community in the right way. Thank you.
I think to answer your question, the annulment would not be available for like a landlord or an employee to see, employer, but it would remain available for law enforcement to see if they were running a background check for that purposes. Representative Scher.
And just to add to that, there is a law, New Hampshire law, I don't have the statute number right now, that says you can't ask the question, have you ever been convicted of a crime, without attaching that, have you ever been convicted of a crime that hasn't been annulled? So that's another layer to it.
I think the housing issue, though, might be a federal thing. Like if you're applying for federal housing, that
Yes,
you would be barred.
If you were applying for federal housing, then
Yeah.
that would definitely be the case.
Yeah, exactly. See no further questions. Thank you.
Thank you very much, Mr. Chairman, for your time.
good
and
to see you
members of the
again.
committee. Good to see you as always.
The chair calls the Honorable Tom Mannion.
Thank you, Mr. Chair, members of the committee. You guys, in the last bill, you were mentioning the ATF, and I thought that was a really good point. And that comes into play here when we have the ATF Form 4473, where Section 21F requires that you admit whether or not you are a cannabis user, and that disqualifies you from purchasing a firearm. So I think the annulment here is a great way to protect your own ass against like whether or not the ATF's going to come down on you, like do a cross search against whatever it may be in your history about cannabis use when you purchased a firearm, because they can flag you as like for a felony if you lie on this form. 5 years. And like, so like coming from my perspective, I think that this bill does a great job of trying to protect people against, they may not be aware that cannabis is prohibited by the federal government. You can't own a firearm if you're a cannabis user. And with that, I'm open to any questions.
Thank you.
Thank you.
No. The chair calls Heather Marie Brown. Heather Marie Brown. Oh, there you are.
I promise you will only see me one other time today besides now. So my name obviously is Heather Marie Brown. I am here in support of this bill. This bill has actually, this topic has actually impacted me personally. So by the time, before I graduated high school, I was able to experience a program called the Epsom Earn and Learn program. What that program did was it took high school students that were close to graduation and it gave them training in the field of certified nursing assistants with a specialty in geriatric care. It had always been a lifelong dream of mine, ever since I was a small child, to be involved in the medical field. Even now, I still dream of being involved in the medical field. By the time I was, before I even graduated high school, I was licensed by the state of New Hampshire as a certified nursing assistant. My plan was to experience that and to work in that realm for a few years and then use the abilities that the job gave me to be able to pursue a better career in nursing. My goal was to take each of the steps necessary to move up the ladder so that ultimately I could be in a wonderful position where I was working hand in hand with patients and I was giving that love and comfort and support and medical care that I so desperately wanted to give. Unfortunately, because of a couple of cannabis arrests, one of them included, this was probably my favorite, I had a bowl on me and I was not charged with paraphernalia. I was charged with possession because the bowl was dirty. So therefore, I was in possession of cannabis. It made the charge a little heavier and a little bit more substantial, and it sure cost me a lot more money in the long run. So I have a couple of small arrests on my record. I was extremely excited when the first bill passed and that it became a possibility for me to possibly get an annulment because that meant that I could continue moving forward in the medical field. Unfortunately, when you have drug convictions, they really frown upon that and you're not allowed to move forward in that area. So when the law went into effect, I looked into it, and I've looked into it a few times in hopes that maybe the process had changed. But it was such a long and meticulous and ridiculously indescribable process to be able to go through it. Even with working with the court, with the clerks at the courthouse, there was still confusion from them. And the bottom line was that it was going to cost me more money because of having to file with the courts and then having to file with this person and that person and this person. It was going to cost me more money that I just unfortunately didn't have. I am considered a low-income individual in the state. I wish that my circumstances were different, but they weren't. So it became a choice. Do I get my record annulled, or do I pay my bills for this month and keep a roof over my head, or do I buy groceries or things like that? I think that this bill, and I hate to use the term, but it's almost like a cleanup bill. It alleviates those problems that stood in the way. I know absolutely no one that has been able to utilize the annulment process and actually get someplace with it. This cleans it up. This allows for people to get a second chance. This allows someone such as myself to possibly move forward and to better my circumstances and create a better future and outcome for my children. You know, there are all sorts of studies out there that show that children brought up in low-income families, they have less chances at a better future, unfortunately. And, you know, that's something I never wanted to pass on to my children or my family. I want to be able to get my charges annulled. I want to be able to move forward with my life. I want to be able to seek out housing, employment, and even education. I couldn't even attend some of the courses I wanted to attend because of that criminal aspect record of mine. So I hope that you will support this bill. I hope you'll vote it and move it forward. And I think that it'll have a huge impact and really be able to change the lives of so many individuals within the state.
Thank you. See no questions. Thank you for your testimony. The chair calls Dr. Hannon.
Good afternoon. Joe Hannon again. It's been said a lot, so I'll probably be brief on those, but we know about public housing, student loans, limited job opportunities, professional licensure that's been denied. But, you know, the only reason we're even here discussing this is because cannabis laws have been not strictly enforced across the country, across demographics, and the people that do get arrested for it and have convictions are absolutely in the minority of people who use cannabis. In 2021, it was estimated there were 52.5 million people in the U.S. About 19% of Americans had used cannabis at least once. That number was substantially higher for those between 19 and 30. In federal prisons, in federal courts, there were only 145 federal simple possession offenders that had been convicted at all in the whole country out of 52.5 million people that were using it. So we're talking a very small number at the federal level. Most of the people that were in jail are at the state level, obviously. In 22, the president at the time pardoned all simple possession charges, I believe, and there were a total, and dating back, I forget the year, it was many, many years. They went back to the early 90s or 80s even, and it was about 6,557 people that were pardoned. Those pardons have continued at the presidential level, but states have also gone out of their way to right this wrong. We wouldn't be having any legalization bills, any discussion on this whatsoever if it was strictly enforced. President Lincoln said the best way to get a bad law repealed is to enforce it strictly. This law has been stepped around and tiptoed, and we only arrest certain people that aren't going to complain and make a big stink. We've had how many presidents have admitted to smoking cannabis or even doing stronger drugs like cocaine or other drugs? If they had been arrested, if they had been arrested and convicted, would any of those individuals be president? How many CEOs wouldn't be a CEO of a company, or how many doctors or nurses wouldn't be practicing and helping people and saving lives? We are going over a very you think we're just, granting amnesty to everyone who's been convicted, but you and I, most of us in this room, were not those people, or may have been, but they don't target people that are going to come to Concord and stand up to fight for themselves. Usually, they don't target people who are going to make a stink. And I think it's wrong that we have this law that says, we're not going to charge you and throw you into prison. We're just going to give you a fine now. And we're still going to say that stain should be on your record like a scarlet letter, and everyone should know about it so you can't get a job. You walk down the street and see a homeless person and we go, well, why don't they get a job? Why don't they get off their feet? They can't get public housing. They can't get a college education, student loan. We make it harder to keep people down because of these. So the very least we can do is to annul the convictions of people who are at the fringe of society as far as convictions are concerned. The number of people using cannabis, it's hypocritical to even put one person in jail or 6,500 some people in jail in federal prisons over many years when we've had millions and millions of people using this with impunity in some cases. And I'm not going to talk about specifics, but I've talked to reps who said, well, I was a kid and, we got pulled over and they didn't find they found the marijuana and they let us go, but luckily they didn't find our cocaine. I've heard these stories from people in, not this room, none of you, don't get upset. I've heard these stories, not just one, but multiple stories like that from people elected to office. They wouldn't have been here if that police officer says, well, you look like a troublemaker or someone I don't particularly like the looks of, so I'm going to arrest you for this simple possession offense. They didn't even know about the cocaine. They arrested him for that, and they wouldn't be here today. So I think about, we've all made mistakes in our lives. If I had been convicted, if I got charged for any of the stuff I did as a teenager, or, luckily most of us in here didn't have video cameras when we were in high school and college. But think about what would you do today if your life had been drastically changed? What would you be like today if you had a conviction at a young age, or even now? Would you want that to stand for a crime that is no longer a crime in some situations, or is just a misdemeanor in the state? And I'd like you to think about that personally and vote accordingly. I'd be happy to take any questions.
For what it's worth, a few years ago, not too many years ago, I did a study. I looked at all the licensing boards in the state of New Hampshire to see what questions they asked about criminal convictions. It was revealing in that many asked would not allow to grant a license if you had any criminal conviction, like if you were a wilderness guide and you had a criminal conviction, you couldn't get a license. Since then, as a result of that study, the licensing organization in the state, the Office of Licensing, I forgot the acronym, has gone through all the licensing board applications, and they've made a significant number of changes as to what, if any, criminal convictions they're even going to ask about. So want to get that out on the table so you know that.
I'd love to believe that. I think I believe you. I'm not doubting you, but
So is that true?
You're the expert. I believe it. So the answer is I would believe him.
Thank you.
But I also think that it's important to realize that it's not just the professional licensure. There's a stigma associated with it. We love to hang we've seen people say, oh, they're a felon, whatever. It changes your opinion of someone. And that changes not just those concrete things that we mentioned, like jobs and housing, but it changes how we interact with people in society, unfortunately. And I think that's very important that we get away from that. None of us is better than anybody else, and I don't think we should, labels are bad enough. We don't need scarlet letters hanging around your neck for the rest of it. I mean, there was a book about it. I had to read it in grade school or middle school, and it's still there. We've not gotten rid of that concept. Like I said, we're talking about very few people the people that get convicted are not the average person. If they arrested everybody that did it, it wouldn't be against the law because they'd all be rioting in the streets.
Chair calls Sergeant Cataldo. Sorry, I didn't. She told me sergeant. It's lieutenant. Got demoted.
Apologies. Chairman Wright, members of the committee, my written testimony is being passed around. It is in reference to the original bill, so feel free to read it, but a lot of that is now moot. I'm here on behalf of the New Hampshire Association of Chiefs of Police, and we are opposed to this bill. I had a chance to look over the amended bill, which I'll speak to now. So we'd still be opposed to this, and the primary reason is the implementation of sweeping annulments for misdemeanor and violation level offenses for cannabis. First of all, there's already an annulment law that I'm sure you're all aware of that allows people to petition and receive an annulment for the decriminalized amount, which is 3/4 of an ounce, 21 grams. We feel that's an appropriate law in the books. It's already addressed, and people have the opportunity to do that. The sweeping annulment of all misdemeanor and violation level offenses is, in our view, not the purpose of annulments, which we believe are for people who are seeking rehabilitation to move on with their lives, to take steps to do that. Doing this widespread annulment kind of loops everybody in, people that may have had numerous offenses, extensive criminal records. You really don't know the people that you're annulling, where the process we have now in the law that is on the books is much more case by case and intentional. And we just feel that's far more appropriate. I haven't had a chance to read this bill in depth, but that's, for what I have seen so far, what I'm comfortable testifying to at this point. Any questions, I'll be happy to answer.
Thank you. We heard testimony that the current annulment process can be both expensive and complicated. What is your understanding of that?
I obviously haven't been through it. Reading it, I mean, it seems pretty straightforward. It allows for petition to the court. What happens after that petition? I'm not sure. If that is the case, and that can be addressed separately, then making it simpler, making it easier, making it more accessible to people, rather than this kind of what I would feel is a more drastic step, as these sweeping annulments, which, like you said, Chairman, that's another issue, puts quite a bit of onus on the Department of Safety to do, which I'm not even sure would be fully possible.
I'm not sure that they would be able to do it either. And to your point, so if someone could be theoretically an active, not only drug user, but involved in various crimes and automatically receive this annulment, is that your understanding?
Reading the bill I have in front of me and listening to the testimony, yeah, these are, it seems pretty clear. Convictions and arrests for misdemeanor violation of possession of cannabis prior to the January 1st date shall be annulled with no qualifiers as far as criminal records, ongoing behavior, anything like that.
Thank you. Any further questions? Yes, Representative Paquette.
Thank you. I just have a quick question. It says remove misdemeanor and violation level offenses. What is the difference between those two as it applies to this specifically?
So misdemeanor would be like, as the law stands now, it's anything above that 3/4 of an ounce would be an arrest. So 21 grams, which, I mean, if anyone's familiar with usual level amounts of marijuana, so, I mean, I think people typically smoke half a gram up to a couple grams at a time. So if people are in possession of over 21 grams, that is quite a significant amount. And that would be the misdemeanor. Anything below that right now is a violation, which is essentially a ticket, similar to what you get when you do traffic infractions. Those are also violations. So this bill would annul not only the violations, but all the misdemeanors for people in possession of above that.
Thank you.
If you're aware, do they, is a private company or an employer or anything like that, do they have access to violations on a record check?
Not that I'm aware of. I can't speak firmly on that, sir, but
Yeah.
not that I'm aware of right now.
Okay, thank you. What was you saying? Rich, you had a question? No? Okay. All right, thank you for your testimony.
Thank you, sir.
Is there anyone else wishing to testify on this bill who has not testified or filled out a card? Seeing none, I hereby close the public hearing and we will reconvene at 1:30.
could ask everybody to find their seats, we can settle in to start our afternoon public hearings. Good. All right. I am opening the hearing for House Bill 198, and I welcome the sponsor, Representative Sullivan. Introduce the bill.
Hi there, Madam Chair. Thank you for taking my testimony and presentation of the bill. So, for those of you that were here last year, we all know there was a bit of drama and back and forth with respect to cannabis legalization in New Hampshire, and so I wanted to take the lead on trying to legalize for possession, legalize it in the state, but this does not deal with the selling. So what I learned through this journey of the last couple of years is that many people in New Hampshire and in this body, and even on the other side of the aisle in the Senate, they by and large seem to be supportive of no longer arresting people and essentially ruining certain people's lives for something that by and large many people in our society have grown to accept the consumption of cannabis by responsible adults. But it remains illegal in New Hampshire. We're an island in New England. And so the goal here is to not get caught up in what has been our stumbling block for the last, 2 years that I've been here, but also prior to that, is how we sell it and regulate it. So this doesn't touch that. The goal of this is simply to legalize this and allow for reasonable quantities of possession, which is 2 ounces. It prohibits things like smoking in public. I spoke to some senators when I was drafting this, and they were concerned about public smoking. So I put that in here. Hopefully that will appease some of the concerns that some people have with respect to people smoking and potentially secondhand smoke, and then some of the concerns that come from that with respect to public consumption of cannabis. I think it's important to understand that this language is very similar, almost identical to the language that the House passed and sent to the Senate last year, and then was sent back to us for the concur motion at the end of last term in terms of the legalization bill. So this is very similar language with very minor tweaks. And also there is precedent for this method where we legalize without regulating how to sell it first. Vermont did the same thing. They actually legalized it, and a few years later came back with a regulatory framework on how they would allow license and then regulate the sale of cannabis in the state. And so my goal here, again, is to stop arresting people and locking up people who are not committing violent crimes, who are really just consuming something that is legal in every surrounding piece of land, whether it's Maine, Canada, Vermont, or Massachusetts, and is generally considered by most in our society to not be as harmful as it was thought to be in times past. And importantly, the majority of people in New Hampshire do support legalization and don't like the idea of locking up people for the possession of cannabis in New Hampshire. So this would put an end to that practice, and I hope that you guys will be supportive of it, and I will take any questions.
Thank you for your testimony, Representative. Well, look at you getting off easy.
Such an easy day. Thank you very much.
Seeing no questions, thank you very much. Representative Howard.
Thank you, Honorable Madam Chair and committee members. Thank you for having me back again. My name is Representative Heath Howard. I represent the towns of Stratford and Barrington in Stratford District 4. I'm here in support of HB 198 because it legalizes the possession of 2 ounces of cannabis for recreational use for people 21 years of age and older. But it also creates penalties for smoking and vaping in public. It does not legalize the sale of cannabis. It does not allow people to operate vehicles while inebriated under the effects of cannabis, nor does it allow for cannabis to be grown. Essentially, this bill is a legalization bill for home use only, with the express goal of protecting people for simple possessions for situations like during traffic stops. This is not my preferred method of legalization. but it is a basic compromise that maintains the public norms while also giving people new individual liberties to use on private property. If somebody is caught smoking or vaping in public, they can face a fine starting at $100, going all the way up to a Class B misdemeanor, depending on how many offenses there are in a 3-year period. That maintains the current status quo. And personally, I mean, I think it's a little bit excessive, but especially for vaping where there's minimal smell. But again, it's trying to reach out across the aisle and get something through so that we can actually legalize the substance, because there is very minimal public safety risk. With that being said, I'm open to any questions. Thank you.
Seeing none. Oh, change your mind. Representative Muse?
Can you talk a little bit about how the bill treats people under the age of 18 and what protections it includes for them?
Yeah, so obviously because this is a legalization bill, this still does have illegality for people under the age of 18. Let me try and find that real quick. There might be somebody who could better talk to this off the top of my head, because it was the one thing that I didn't write down. Any person who's under the age of 18 who's convicted of violating paragraph 4 or 5 shall forfeit cannabis and shall be subject to delinquency petition under RSA 169B6. So it does, I'm not sure off the top of my head how that changes the current law. Apologies. Sorry.
So this is my 4th term, and I haven't run into a delinquency petition yet as a potential penalty. Do you know any more about that than I do?
Somebody might be better able to address that.
Thank you.
Representative Scheer?
I'll try and put this in the form of a question. So, would you know that a delinquency petition is it's the juvenile equivalent of charging someone with a crime? So if you want to charge a juvenile, someone under the age 18 with a crime, you file a juvenile petition. And it's adjudicated in that fashion. There's more deadlines, but that's what a juvenile petition is.
Well, thank you.
You know that.
I clearly was not as prepared as I should have been. Sorry.
Anyone else? Good? You good? Yes.
So at the age of 18, does that go away?
No, it's confidential.
Okay.
It doesn't go away, but it's confidential. It's different than an annulment. It can't be revealed.
Okay, thank you.
Thank you, Representative.
Okay. I do see on page 2 at the bottom in section. Oops. Page 2, section page 2, line 33. Line 36. It does say that they also will be subject to a fine of $100 for a first or second offense, and a fine of up to $300 for any subsequent offense. So there is a penalty.
Yeah.
Okay.
Yes, that is the current penalty right now.
Okay. Thank you.
All right. Thank you very much, Representative.
Thank you.
I'll see you. Is there a Mr. Riddle here? Score.
Welcome. Madam Chair and members of the committee,
My name's Jim Riddle, Hillsborough, New Hampshire. I serve on the board of the New Hampshire Cannabis Association, as well as on the Policy and Education Committee of the Northeast Organic Farmers Association of New Hampshire. I serve on the Hillsborough Conservation Commission and am moderator of the Emerald Lake Village District. But I offer comments today on my own behalf in support of House Bill 198. And there are two things I like about the bill right off the top. It doesn't create any new bureaucracy, and it doesn't cost taxpayers any money. I think we can all agree that the state of New Hampshire doesn't really like to establish or maintain bureaucracy. I mean, the Department of Agriculture, Markets, and Food mismanaged an organic state-run organic certification program till it was finally closed down last year. And as you may recall, there was a bill last year to legalize cannabis that would have cost taxpayers $18 million to establish a Soviet-style state-run cannabis monopoly. And I want to thank you for rejecting that bad idea, by the way. But if instead of establishing new bureaucracy, House Bill 198 essentially raises the cannabis possession limit from 3/4 of an ounce to 2 ounces. It prohibits smoking or vaping in public and makes it clear that minors cannot legally possess cannabis. And while the bill does not establish a legal market or support business investment here in New Hampshire or provide a way to tax cannabis, it's important to take a moment to review some of the experiences of states that have established legal cannabis markets. Such states have brought in tens of millions of dollars in tax revenue. They've seen increases in jobs, in tourism, in business investment, and given young people a reason to stay in those states. In state after state with legal cannabis, youth cannabis use has actually fallen. It's true. Along with the rates of opioid overdoses and deaths. Another interesting thing, in Ohio, which recently established a legal market, the Department of Public Safety reported a 30% decrease in traffic fatalities in the first year of having an adult use cannabis market. So those are some of the real life impacts that are happening with legal cannabis in other states. Well, this bill, HB 198, will not establish a cannabis market, but it does recognize the fact that many Granite Staters purchase cannabis in Maine, Vermont, and Massachusetts and bring it back to New Hampshire. Now, we may not want tax revenue or increases in tourism or business investments, but we can at least save money on unnecessary and harmful enforcement actions. This is an efficient bill, and it needs to pass and let the citizens of New Hampshire live free. Thank you.
Thank you very much. Are there any questions? Seeing none, thank you very much. Matt Simon.
Thank you, Madam Chair. For the record, Matt Simon. I work for Granite Leaf Cannabis. This bill doesn't have anything to do with the therapeutic cannabis program. It wouldn't have any impact on the ATCs. We support it as a matter of principle, and I'm going to make a few brief comments that come more from my experience working on this issue in New Hampshire and in other states. So I think one thing New Hampshire has learned in the last couple years is that cannabis legalization is not a yes or no question. We often hear it presented as a yes or no question in the media. When a pollster calls somebody and asks, do you support legalizing cannabis? It's presented as a yes or no question. But every actual cannabis legalization bill contains typically dozens of policy choices, some of which may be good or bad, all of which are debatable. And many bills get derailed over people not being able to agree on those dozens of policy choices. So I had the privilege several years ago of working on the legalization campaigns in Vermont, worked closely with the Vermont state legislature as they became the first state legislature to legalize cannabis. And we went through this in Vermont. There were a number of bills trying to regulate cannabis. There were a lot of interests that had opinions about how cannabis should be regulated. There was a lot of difficulty reaching a consensus on this. All the previous states had just done it through ballot initiatives, where those policy choices were made by the drafters of the initiative, and then voters had a yes or no question in front of them. Doing it through the state legislature makes it a lot more complicated to build consensus. So when Vermont failed a couple of bills, they went back to the drawing board and said, actually, what do we all agree on? We all agree that Vermonters should not be punished if they're adults for possessing cannabis. So they passed their first legalization bill, was very similar to this. It did include home cultivation, which this bill doesn't. This bill only applies to personal possession. But the idea was stop punishing people. We all agree on that. And once we pass that, hopefully everybody will come to the table and we won't be arguing over legalization anymore. We'll be arguing over how to regulate cannabis properly. And Vermont did 2 years later pass what I consider to be the best cannabis regulation law in the country. I'm hopeful that New Hampshire could take the same path. If this bill goes to the other chamber, or if a complex bill goes to the other chamber, there will be dozens of policy choices that could derail that other bill. If this simple bill goes to the other chamber, it really is a yes or no question. Do you think adults in the live free or die state should be punished for possession? And so I think this is a good bill, both strategically as well as on policy. Turning briefly to the questions about under 21, my understanding is that this bill doesn't change the existing policies. I worked with this committee back in 2017 on the bill that ultimately became law, decriminalizing up to 3/4 of an ounce of cannabis. And at that time, we had a very robust and detailed discussion about what that should mean for people under 18 and for under 21. What is the most appropriate intervention, if not criminalization? And with buy-in from a lot of organizations, from a lot of different perspectives, we reached the compromise that is now law. And I believe it's exactly what you see before you, that under 18 is a delinquency petition, the most appropriate way of dealing with that. And for anybody 18 and older, it would be a violation. So this maintains that violation for 18, 19, and 20-year-olds. It would still be the violation that it currently is under decrim, and it simply eliminates the violation for people over 21 and changes the amount, I believe. But other than that, I think it's pretty straightforward. I think it's consistent with New Hampshire's decriminalization law, a logical next step forward in preventing granite staters from being put into the criminal justice system for simply possessing cannabis. That's all I have. Happy to take any questions.
Representative Prue.
Just curious, when I drink alcohol, I get pulled over, there's a test to say whether I should be driving or not. Is there one for cannabis yet?
There is not.
Yeah.
Representative Paquette.
I have a question that's kind of related. It says in here, you can't drive under the influence. So this clearly says that. But, if you're in your car, are you in your personal property or are you in public? Like public is a no, personal property is a yes. If you're in your car somewhere, because, we've all been there and then, been somewhere driving and then there's, huge puff of smokes coming out of the car and now it's in yours. I mean, how does that work with this?
I'm going to leave that one for an attorney. I will. Yeah, I don't have an easy answer on that. I will note that New Hampshire has other laws. For example, last year, the open container law that passed this committee added cannabis to the open container statute. So simply possessing an unsealed container of cannabis anywhere in a motor vehicle is a violation, and that comes with a possible driver's license suspension. So I happen to strongly disagree with that law, but did not testify against it. That's another issue. It is illegal elsewhere in the criminal code to drive while impaired on any substance. We have breathalyzers that are trusted for alcohol. For every other drug, we do not have either a specific legal limit that is accepted by science or a specific way of testing for it other than a blood test, which gets you to a conviction. Every other state has gone through this discussion of what impaired driving policies may need to change in light of legalization. 2 points that I'll make. One, there is no evidence that prohibition has been effective in deterring use. So New Hampshire has one of the highest cannabis consumption rates in the country, and we had that before decrim. We had that before medical cannabis. It's because we're in New England, and New Englanders smoke more cannabis than people in the Southeast. It has nothing to do with policy. So the expectation was that use would increase dramatically after legalization. I think it's pretty clear that hasn't happened. There have been modest increases in use that have mostly been among the older population, the population where use has increased most in states that have tracked it. It's the over 50 crowd and the over 65 crowd more than young people. As Mr. Riddle said, the evidence is overwhelming that minors are actually using less cannabis in the wake of legalization. So often cause and effect are counterintuitive, but it's already illegal to drive while impaired. And we have a process for convicting people. It involves officers who are trained as drug recognition experts. And if somebody's thought to be impaired by any substance other than alcohol, we have a process for getting that person convicted and off the roads. And that will be the same process whether cannabis is legal or decriminalized or illegal, would be the same.
Thank you. Representative Scheer, you are recognized for a question. Go you.
I'm very proud of myself.
We
today.
are so
Thank you.
excited. Thank you. Is there any other questions?
Thank you.
All right. Thank you. Dr. Hannon?
Thank you again for hearing me today, Joe Hannon, and I'm not going to speak for very long, I promise, even though I could. But 1954, Robert Borkenstein invented the breathalyzer. It was 21 years after Prohibition was repealed, just for historical references there. Like it's been said, this bill has basically gotten rid of most of the contentious issues that had been a problem in the last 10 plus years that I've been doing this. I was on the commission back in 18, and the number one, the biggest issues were how are we going to get it to people? This does what, it solves that problem. It doesn't do it. And I think we should just pass this bill. If you have any questions, I'd be happy to answer them. I'm really not going to talk anymore, I promise. Unless he asks me a question, then I'll.
No.
All right. Thanks.
None? All right. Seeing none, thank you. Is there anybody here that wishes to testify on House Bill 198 that has not turned in a pink card? Seeing none, I am closing the public hearing for House Bill 198. And let's see what time it is. I wish we could just. So anybody that's here, our next hearing is not scheduled until 2:30. We apologize, but we do have to stick to this hearing schedule. So if anybody does want to testify, they have the opportunity to do that. So the committee will be in recess until 2:30. Good afternoon again. So it is now 2:30. Our little recess is over. Is everybody ready to go? Okay. All right. So I'm going to open the public hearing for House Bill 226 and recognize, is there somebody here? Representative Newell, you're going to introduce the legislation for us? Oh, it is your legislation. Representative Newell.
I sure am. All right. Thank you, Madam Chair, and thanks to the committee for your time and consideration today. For the record, my name is Jody Newell, and I represent Cheshire 4 and Keene. Some of you will remember this bill. That last term, a similar bill was proposed. We created a subcommittee, we poured over the details, brought in stakeholders and experts, and ultimately passed that bill out of committee and through the full House. Unfortunately, that bill died in the Senate, so here we are. Due to the importance, though, of implementing this policy, we decided to take a really good look at the concerns expressed and adapt. So this is the resulting bill that we have here today. It's 2025, and while we have done an extraordinary job of building out our system of substance use prevention, treatment, recovery, and harm reduction, we are still losing loved ones to overdose. Too many people have been lost, and too many people are still struggling, still at risk. One important element of a comprehensive harm reduction strategy involves the ability to analyze substances on our streets. In fact, much of the rest of our system depends on a complete, accurate, and dynamic understanding of exactly what is on our streets and where. While we were able to pass fentanyl and xylazine test strip decriminalization last year, this provides very limited information. So I'd like to direct technical questions to our experts who will be speaking after me, but to briefly explain, a test strip identifies the presence of a substance and only that one substance that it is intended to identify. It does not measure how much of that substance is present or whether any other substances are present. Fortunately, there are tools for a more deep analysis. This bill would allow for organizations registered with DHHS to use this equipment in order to gain more information about what is on our streets, and with that, help to target assistance where needed, ultimately saving precious lives. So I thought it would be helpful to work my way through the bill and kind of just so we can understand what is in here and why. So starting out, what it changes it to drug paraphernalia. On page 2, lines 13 through 16, what we're doing is we're amending in order to draw a clear distinction between what uses and intended purposes drug testing equipment is allowable for and what it is not allowable for. On page 2, lines 17 through 26. This is a bit of rearranging in order to add additional exemptions, but I want to note that we maintained the language that was passed in 2023 through the House and through the Senate, ultimately signed into law by the governor, which is decriminalizing fentanyl and xylazine test strips and adding the conditions and the conditions under which that exemption was made now apply to the rest that we are adding. On page 2, lines 30 through 36, this is where we carve out an exemption for drug checking equipment, the necessary materials when used by agents of organizations that are explicitly authorized by state, county, municipality, or a public health department. On page 3, lines 1 through 26, at this point, we needed to add some more further definitions, including drug checking, drug checking equipment, drug checking packaging, eligible activities, and harm reduction for the purposes of this section. On page 3, lines 27 through 36, here we are clarifying that drug checking equipment or materials used for this purpose would not be considered drug paraphernalia only when used by harm reduction programs registered with New Hampshire DHHS. On page 4, actually, we have, I've put in for an amendment because there was something that we left in here that we wanted to take out. And But this is where we affirmatively state that drug checking is permitted in this context.
Wait, Representative, can you hold on just 1 second? I just want to. Okay.
So on page 4, this is where we affirmatively state that drug checking is permitted in this context, that the state may allocate funding, including opioid abatement funds, and federal funds intended for this purpose. We clarify that no person engaging in drug checking under these circumstances, and by this we mean employees of the organizations that we explicitly state should be able to do this, that none of them should be penalized for engaging in drug checking work, and that the results of drug checking analysis should not be used for nefarious purposes. In this section, I just want to note, let me see, it is on page 4, line 7. I actually just put in for an amendment. They said if it wasn't ready by 2:30, it would be shortly after. And what that amendment would do would take out on line 7 on page 4, a nominal amount of one or more controlled substances or controlled substance analogs. And we didn't mean for that to be in there. The point is that this would be just for harm reduction organizations, public health organizations, and the employees thereof. So we did not intend for that to be in there. So we've just made a quick correction to that. And I think that's about it. I'm happy to take any questions.
Representative, could you just point me? There was something you had just said, and I was trying to read it, but I was highlighting something else.
Yep.
It was one of the last sentences you had mentioned about, I think it was the like the amount, you said nominal.
Yes.
What
So
line-
we had
You're fixing that?
intended. I'm sorry, what?
Was that the one you said you were fixing, or that's the
Yeah.
amendment?
Yeah, that's the one that we're taking out. So what it is that we do want to allow for employees of organizations who are tasked with this to be able to transport. So all of the things that are included in drug checking materials, and that is included in what is allowable by employees of this organization explicitly for that purpose, but not for anyone, not for anyone who is coming to have their have things tested.
Thank you.
So I hadn't realized that it wasn't in that section, that it wasn't only for those folks, and so. Yeah, so we put in an amendment for it already and should have it back soon.
What section is that in here? for me,
So
just to make a note?
that is on page 4,
Okay.
line 7, starting on line 7 and going into line 8. So it would strike a nominal amount of one or more controlled substances or controlled substance analogs.
I see it. Thank you. Okay. And then I just have another question real fast, if I may.
Yeah, sure.
So I'm looking at page 3, and it is on line 11, and it's basically the very end, it'd be like the next sentence. Drug checking equipment does not include the substance being analyzed, drug packaging, or drug supplies. So can you explain how that would work if it's, if this person clearly has drugs on them, and then they have some drug checking equipment, what would that look like? Or what does drug supplies mean?
So right here, what we're talking about is what fits under the definition of drug checking equipment. So it's clarifying that that does not fit under the definition of drug checking equipment.
Thank you, Representative. Okay. Are there any questions for Representative Knoll? No. Seeing none, thank you very much.
Got off easy. All right.
Run.
Thank you.
Representative Selleck.
Good morning or good afternoon. Hello, friends. It's nice to see you again. For the record, I am Lauren Selig, and I represent Stratford 10, which is the town of Durham, New Hampshire. And one of the things that I think many people forget about when they talk about this committee being the Committee of Criminal Justice is the second half of the name, which is the public safety component. It's criminal justice and public safety. And when I think about public safety, a large part of that is making sure that people stay alive and are able to stay alive and be well. we know that we have people who unfortunately suffer from addiction and to various substances and different kinds of ways. And we can't help them if they're not alive, right? If they overdose and die, there's no more that we can do to help them get to a space of recovery around their addiction or anything else. So when I look at this bill, and when we worked on it last year, and I remember how very hard we worked on this bill to get it through, I think about that this is a goal intended for the public safety component to help people who suffer from addiction make sure that what they're using isn't filled with things that they aren't aware of that are likely to kill them or increase the likelihood of their dying on that particular day. Because if they live one more day, we have a much better chance of helping them get to a place of being ready for recovery. Interestingly, as I was thinking about what comments I wanted to make today in front of all of you, I was also looking at my social media feed from a year ago. I had posted about being proud of our committee for having passed this bill and moving forward, but also on this day 1 year ago in Littleton, New Hampshire, we had 3 young people in their 20s all succumb to addiction. They overdosed as a group because of a substance that had been in the drugs that they were using. Drugs they were choosing to use were full of things they weren't aware were in there that led to their overdose and death. And so I really hope that you pass this bill. I encourage you to continue to support it and to help it succeed through the Senate, ideally this time as well, so we can get it to the governor's desk for the purposes of helping people in the greater public. Thank you.
Representative Muse?
Thank you. My name is Representative David Muse. I represent Rockingham 37, the communities of Portsmouth, Newcastle, and Newington, and I'm testifying in support of this bill. In New Hampshire, we've been dealing with an opioid crisis for much of the past decade. And this is one of the first years, I think, when we've really been able to report that we have made some substantial progress. So last year, according to the latest count that I had in 2024, we unfortunately had 199 opioid deaths in New Hampshire. In 2022, that was the total was 430. So in a 2-year period, we've actually managed to cut that in half, which is a tremendous accomplishment. And one of the things that's happened as a result is people are scratching their heads going, well, what's going on? What's the factor? What was the silver bullet? And I think the conclusion that a lot of people are coming to is it wasn't necessarily any one silver bullet. It was the fact that one of the things we did in New Hampshire that was very successful was we adopted an all of the above strategy. So one of the things that law enforcement did is it targeted Mexican cartels, U.S. distributors. Law enforcement community in New Hampshire has tried to make life very difficult for individuals who want to sell people fentanyl and other opioids. Harm reduction services, things like expansion of the availability of naloxone, so more people who overdose have rapid access in time to a drug that can save their lives, has made a difference. Dealers and manufacturers may also finally be starting to discover that killing your customers isn't a great way to conduct your business. So one of the things that has been happening is the tremendous amounts of fentanyl that were just commonly found in fatal quantities, very, very commonly in the drug supply. Still will find that not quite as common as it was a few years ago. So there are a lot of things that are coming together to make things better. I think the thing that we need to keep in mind is just because things are getting better, it doesn't mean it's time to take our foot off the gas pedal. We're still in a crisis. There are still people dying, and there's plenty of work left to do. So one of the things that this bill would do in particular that would be just tremendously beneficial is that currently, when we want to legalize a new piece of drug checking equipment like fentanyl test strips or xylazine test strips like we did a couple of years ago, the way that our statute is written, we actually have to add that in statute. So last year when I testified in front of you, I told you about a drug called xylazine. which is a new fentanyl analog, 2 to 50 times more powerful than fentanyl, which is not detected on fentanyl test strips. And at the time I said, well, gee, if a test strip was available for this particular drug, Zitazine, you know, it would save lives. But the problem we're running into in New Hampshire is that if we can't put it in our statute, then some of the public health professionals, you know, who are doing the testing and are trying to get this stuff out into the community, you know, might be at risk of violating the law. So rather than having us always have to get together as a committee for every one of these innovations that comes along, one of the things that this bill would do is it would legalize innovations in drug checking as a class. So for instance, if a new test strip was available that tested for Zitazine, then it could instantly be deployed in a way that could save lives. If a test strip was available that could test across multiple drugs and show a return, we would be able to deploy that instantaneously without worrying about any potential violations of the law. So one of the things that it just does is it makes our statute easier to work with and more responsive to scientific innovations. One of the other things that this particular bill does is it also would legalize opioid reversal agents as a class. So naloxone is an opioid reversal agent. It's very effective against fentanyl and other types of opioids, less effective with other drugs. There are new opioid reversal agents that are currently under FDA testing that are just about ready to be released that could make a difference. There are some people who might not be able to be revived with naloxone. So one of the things that, again, we're trying to do is as these innovations become available, we want our law to be a facilitator and not a barrier when it comes to saving lives. The issue that we had last year with a nominal amount was something that we kind of worked through in this committee. It proved to be a showstopper over in the Senate, and I know there's been a lot of issues with it on the part of the law enforcement community. But when we talk about a nominal amount, it's the idea that what are you putting on that fentanyl test strip? And so last year the idea was, well, gee, what we'll do is we won't include that for prosecution. It's like a 10 milligram or less thing. We went back and forth. Should we define it? How do we define it? And the problem is the reality is you need some level of these drugs to test. But I think the issue is we don't want to be in a position where we're ever really legalizing any amount of a controlled substance. So one of the things that we're doing, you know, that we want to try to do this year is to amend the bill so that essentially people who actually work in testing, so public health professionals, they won't have any legal exposure for testing the drug. Same as like people in our state police lab. We don't want them to have exposure if they're testing drugs either. On the other hand, one of the things that sometimes you have to kind of agree to disagree, or that's probably not the best way to put it. But I think sometimes you just have to come to a realization that that a small minor detail that you think might make the law better and more descriptive sometimes can be a showstopper, and the best thing to do is to take it out. So legalizing any kind of nominal amount for possession on the part of an individual who is not part of testing is not something that this bill will do anymore. As a practical matter, I don't think we're going to see police arresting people for what's on a fentanyl test strip. So as a practical matter, I don't think it's an issue. I think the law enforcement community is behind the effort of saving lives. I mean, this is something a lot of people in the law enforcement community are the people who are administering naloxone and reviving people. So I think I think what we're really, you know, trying to do here is to really work with the law enforcement community. And one of the things that I know we wanted to talk to the chair about was forming a subcommittee. We've talked with Beth Sargent, and kind of reviewed in principle some of the things that we're trying to do in the bill. And one of the things that she's indicated to us is, a willingness to work with us to kind of get something through. Whether or not we can get something through remains to be seen. Whether or not we can agree on something, in final form, I think it would be fairly easy to do, but I never want to suppose. But the bottom line is we got this through this committee last year. We got it through the House. It's really worth trying to do, and I would urge, I would just urge you to consider it and support it. And thank you.
Thank you, Representative. Any questions? Representative Newman?
Yeah, I just have a question. So people can have test strips, they can test with the test strips, and then I'm concerned about how does that get to the organization that can test it? Do they bring a test strip to the organization?
I think,
Or how does the entity
we do
that
have
tests
people coming after me who can probably
Okay.
describe that process in better detail, but there's more to it than just individual drug users using test strips and things like that. There are also public health agencies that are out there, testing testing drugs that are coming in that people will bring in sometimes. So I think they'll be prepared to talk a little bit more about that.
Okay, thank you.
All right. Anyone else? Thank you, Representative.
Yep, thank you.
Representative Mannion?
Thank you, Madam Chair, members of the committee. For the record, I'm Tom Mannion. I'm representing Hillsborough 1, Pelham. I'm in support of this bill. Just wanted to be real brief. I think the representative from Durham hit all my points about public safety. I just wanted to mention the entire purpose of alleged purpose of the war on drugs is to save lives. And sometimes these state laws get so hamstrung that you end up costing lives in the process of outlawing test strips, things along those lines that could do a lot good for the people. So with that, I mean, I think all my points got handled, but if you have any questions, I'm here to take them.
Looks like we're all set. Thank you.
Sweet, thank you.
Representative Siebert?
Hi, I'm Representative Christine Seibert. I'm from Hillsborough, District 21. And I just wanted to come up here and voice my support. I'm a co-sponsor on this piece of legislation. I believe this is really important. I'm already proud of what we were able to pass last term. And I really believe this is a huge chunk of, well, a huge part in the toolbox, a big tool in the toolbox for, making a difference out there on our streets. And I believe the numbers are showing for it. They speak for themselves. So I believe these changes need to take place to further allow for us to make a change within our communities and to also show our law enforcement, our first responders, that we understand that it's been a struggle these past years. So with that said, that's it. And just please support this legislation. Thank you.
All right. Thank you. Dr. Hannon? You're all set? Look at that, Representative Prue.
Nice job.
Oh, let's hurry up and go. Ms. Beal? Dr. Hannon, we're just razzing you because you're a welcome, welcome guest. Yes, you may. So, okay, if you could, you're both certainly welcome to testify and kind of tag team with each other. If you could just please both make sure you introduce yourselves and then just let us know, in support or of course oppose, which looks like support. If you could just please state that.
Absolutely. Well,
Good afternoon, everybody, committee. My name is Liz Boley, and I'm the Director of Education and Technical Assistance at the New Hampshire Harm Reduction Coalition. I have been there for I have been there since 2020. I was actually fortunate enough to be hired by Dr. Nolte herself. And in that time, I have had a lot of time working with folks who use drugs directly, folks who are unhoused, and folks who are in active chaotic use. Before being in harm reduction, I worked in treatment and human rights, so very familiar, but while the majority of my work is with individuals who are unhoused and in chaotic use, I've also worked alongside folks in long-term recovery, abstinence. I've worked with family members, scared parents, college students, working professionals, doctors, lawyers, businessmen, really anyone looking to educate themselves. I do all of the overdose prevention and response training for our organization, and in that I get asked a lot of questions about what is currently in our illicit drug supply in New Hampshire and how can Granite Staters stay safe. And I do hate the idea of not being able to give anyone a exact answer because unfortunately we just do not have the information. We can make anecdotal stories and evidence, but we don't have the direct data in front of us. While of course we should be worried about the presence of synthetic opioids and their various analogs, there are other adulterants that are being found in the drug supply, such as xylazine, which is a tranquilizer, and the one that worries me the most is various kinds of benzodiazepines. Who are using drugs, when they are looking for treatment and recovery, if they are not intentionally using benzodiazepines, but they come up on their drug screen prior to entering treatment, they can be barred from that because they need to go through detox. And unfortunately, we know in our Granite State, we do not have enough detox beds for folks. So somebody who is ready to go into treatment is not able to do so because they need that benzodiazepine detox instead of just thinking that they used opioids. So I think it's also important to note that this bill is not legalizing any of the technology talking about in the bill. Anyone with an eBay account and the cash can go and buy an FTRI machine online. I actually did the work and found about 12 pages of FTRI machines that if you have a grand in your pocket, you can buy and you can start testing any drug. But when we are able to put this technology and the ability into the hands of public health officials, it does put us a step ahead in the illicit market. So a major worry is, of course, college students. In 2023, the DEA seized over 29 million fake pills that contained illicit fentanyl, which was a 33% increase from the year before. College students are looking for pressed pills because they are looking for things like Adderall, oxycodone, and those are usually not just to quote unquote have parties with, but those are usually to stay awake so that they're able to study, finish their papers, things like that. And unfortunately, they are getting things that have opioids in them and they're unable to reverse an opioid overdose if they are by themselves. In other states that do have drug checking policies, they are seeing things like GLP-1s, or as we know them, Ozempic, in their drug supply. So a lot of compounding pharmacies do not have the oversight that we need to be able to keep these specific drugs out of those supplies. And also for folks who are using GLP-1s, they would have the ability in this bill to come to a drug checking program and see what is in their third-party GLP-1s. So if they're buying something off of an online pharmacy, which the DEA last year in October did release a public service announcement stating that online pharmacy purchasing for medications is risky and can have various analogs and completely unknowns to us. During my time in this work, I've watched countless participants pass away because they were not able to continue getting their Suboxone prescription, which is their medical assisted treatment, or methadone. And this is because they miss an insurance. There's a litany of reasons. But because they're unable to get that, they then have to unfortunately turn to a street supply of Suboxone. And a lot of the times that does contain fentanyl, and they unfortunately overdose and pass away. I think that this drug checking bill not only shows you what is in the supply so you can proceed with caution, but it also brings folks in who maybe lost their prescription for Suboxone, methadone, anything, who are still trying to look for connections so that they can continue to use the med, but they're able to connect with public health officials who can get them connected to that prescription again so that they're able to use that completely safe supply. We say a lot of the time in syringe service programs that the needle is the point, because it is the point of engagement for us to bring folks in, for them to trust us. Folks who are using illicit drugs don't have a lot of trust with providers, so it's our job to provide that again to them. And overall, I would say that folks are not necessarily looking for the highest potency substance. They are looking to maintain and stay consistent so that they're not sick. I am someone personally who suffers with chronic pain, and while I don't use opioids to manage it, I know that if my medication went away tomorrow, I would be unable to be a community member, I would be unable to be a partner and a parent. And the fact that people are so terrified of opioid detox because of the physical withdrawal pain should tell us something. And of course, I leave myself open for any questions, but I will pass it over to Dr. Nolte.
Well, the benefit of having Liz go first was that she spoke to many of my points, so you'll hear less from me. I'm Dr. Carrie Nolte. I am a family nurse practitioner in community health, where I conduct healthcare for the homeless in mobile settings. I'm also the chair of the nursing department at the University of New Hampshire and an associate professor there. And my research focuses at the university on reducing drug-related harms, including overdose and infection. I speak for myself as a member of this community and not necessarily my employers, just to put that caveat out there. I did submit written testimony to the committee just a few minutes ago through the portal. I don't know when that gets to you, but you'll have other resources and links there if you want to look more into this. I also provided paper copies of a resource that was developed for New Hampshire decision makers about 2 years ago, or began 2 years ago. And I just encourage you in your public safety capacity to look at that, understand more about harm reduction. There's a variety of strategies in harm reduction. And if I can call your attention to page 12 and 13, it outlines a variety of different strategies. And so I see New Hampshire sort of as a late adopter of many of these strategies, but we have comprehensive overdose education and naloxone distribution. We established syringe services in 2017. This committee established drug checking with rapid test strips in 2023. And so what we're looking to is this next level of comprehensive drug checking. One of the things that came up about drug legalization and past iterations, I hope that this resource helps you to understand, but explain to your colleagues that we're not looking. This has nothing to do with shooting galleries, safe injection sites, overdose prevention sites, which as an academic, I will say have great evidence, but I don't want the conversation to cut this bill off because there's more kind of fear mongering that has happened in past sessions. I commend this committee and on all of this work from introduction in 2023 to retaining it and truly retaining it, and pushing through some of the language changes and things like that. I think one of the points that Liz made that's really important is that we're seeing more and more of an illicit drug market that are not opiates but are weight loss medications. And these are not coming from non-FDA approved sources, they're being imported. And so if tomorrow suddenly we had an outbreak of seizures and syncopal episodes while driving, and we found a common cause, you know, we don't have the ability in this state to address it rapidly in ways that other public health departments do. So I think the primary driver of this should be wanting to prevent overdose and getting people into recovery. And I will just share personally, this deeply affects me on a personal level. The third author on the resource that we developed, unfortunately, was having a lot of struggles, had been in long-term recovery, and didn't show up to a meeting. And after checking on him, I found one of my best friends dead from an overdose. He had been using a substance in order to sort of get him through. It was not an opiate. He had not gone back to using opiates ever, but that the substance he was using was eventually confirmed to have fentanyl in it, and that was his cause of death. So he would be here advocating for this exact legislation, if he was here to be here. So I think that the other component, and again, there's more in the written testimony, but is just to talk about what this looks like. Currently there's syringe services across the state, not everywhere, but in these programs, these are anonymous, confidential services where people engage with public health providers around getting safer supplies, getting education and testing for HIV, Hep C, referrals to treatment, things like that. We see these programs as then just being embedded in already existing programs. There's not going to be a drug checking shop popping up. There's not going to be anything like that. And so the changes in legislation also really specify the tailoring of this bill to harm reduction programs that already exist. Because as Liz noted, we can all go out on Amazon and buy one of these devices. It's that we are currently missing federal funding that is earmarked for this service and these services that are provided and is being obtained from many other states because we don't have a legal route in order to conduct this. One of the other, and I passed them all out so I don't have it in front of me, but we've had a lot of conversation in this committee in the past around the amount and what constitutes a fatal overdose, and we've talked about that. We have these little measurement spoons that just give you an example of the small amount that is needed for comprehensive drug checking. And what we're finding in states that are doing it is not, this has heroin and fentanyl, but this has heroin, fentanyl, Seroquel, antidepressants, veterinary meds. Like some of these samples have 6 different drugs. And so the trends around rapid test strips, which are only developed for a specific drug, do not keep up with this. And passing this would enable us to develop the infrastructure to develop those resources. There's no budget mark on this. We're not seeking funding for this project or program. This would all be up to the New Hampshire Harm Reduction Coalition and other partners in order to obtain funding for this. With that, one other mention, I'm sorry. The other mention that we had talked about before was xylazine. Xylazine is more and more in our drug supply. In the last year, it was seen in 34 overdoses. And as you know, the medical examiner is well behind in analyzing samples. So that number is as of December. I would expect it to be much higher once final reports come out. The issue from a healthcare provider perspective with xylazine is it is used as a veterinary tranquilizer when used, when snorted or injected by humans. It causes massive ugly wounds that are similar to burns and take a long time to heal. So people will not use substances with xylazine if they know the presence. Another huge barrier and a huge issue with xylazine use is that our current substance use treatment infrastructure is not integrated with medical care. And so one of the qualifying factors for, hey, I want to get into recovery, please get me into inpatient, is, do you have any open wounds? So we now have a drug supply that's creating more and more open wounds, and it becomes a key barrier to people seeking recovery and treatment as they can't get into those treatment facilities because they're not a medical care facility. They specifically focus on addiction treatment. And with that, we're happy. I appreciate the opportunity to be together. One of us can probably answer most of your questions, but both of us together is better. So
two is better than one. So if I may, my clerk was kind enough to tell me when she passed this out, this is like what you guys were referencing. Okay. So is this little spoon, feel like I'm gonna feed a little bird or something. Is that amount, is that enough to?
A flat little teeny spoon here is enough to do comprehensive checking.
Okay, thank you. But is that, if a person were to have that much of one of these drugs that we're talking about, is that enough? Is that a fatal dose?
So the answer is probably not. This is 10 milligrams. So there's two different pieces. There's potency of medication and there's weight. So this is a physical measurement of weight or of a substance. In general, for the potency, a lot of what we've heard is within a grain of rice, within a little speck, within, 1 grain can lead to an elephant overdose. I don't know, I'm making them up now, but there has not been scientific literature that has supported all of that. There's a lot of factors within that. I know that it's one of those potential. I can't say that it's impossible, but there's nothing scientifically to support that this size accidentally encountered could, lead to an overdose. In general, what you would be seeing would be use of 100 times this amount in a single use as far as like a physical measure. And we don't see everyone using that amount overdosing. So did
Okay.
I get to your question or no?
I think so, but I actually have a couple questions. I'm actually trying to learn something here. So if you don't mind bearing with me. Okay. All right. So if this, my understanding from what you're saying though, so that this is what you could use this amount to test this drug, right? Okay. So then what would be considered no longer used for testing? Because I think Representative Noel was was touching on that, but I wasn't able to find it because there was a lot of pages and it looked like the first page wasn't really the bill. It was more statistics, unless I didn't read that right. So I kind of got a little bit lost with the numbers. So is there an amount that is no longer considered to be checking, and it's actually the person has illegal drugs for illegal reasons? Like, where's that line?
Yeah, so one of the changes from prior iterations is that we're not looking for any exemption for people bringing drugs to drug checking, meaning like this is for protection of public health officials doing the testing. The issue with why would there be an amount is, if we test rapidly this small size, part of best practice is to intermittently do confirmatory testing, in which we would have to take that scoop and put it in a secure, safe baggie and send it to an external lab. And so in that time, it would be in possession by the drug checker, by the, person providing the service.
Okay, so that would go where Representative Newell was saying about taking the amount out because there was like no right or wrong, or kind of got convoluted in with that.
That's not so the one that's being taken out is on page 4. That was the one for folks who be coming in for testing.
Okay.
But it is still in there for employees of public health organizations.
Okay. So basically there's not an amount, or there is an amount. I'm sorry. I'm sorry.
No, I believe there is not an amount, but I'm just looking for clarification on the terminology.
But that was for the center, right? Like.
To
Okay.
be able to do confirmatory testing.
Page 2, line 30. It's where it's cut out from public health.
Okay.
And it says an overall amount, not a specific.
Okay. Okay. And then one other question that I have is, so we're, there's a lot of talk about what this has done and the intention of that, which is not lost on me. So my question is though, where's the deterrent? Like, is that part of this program anywhere? Because I haven't heard that, but I don't know. It might be in here. It might just got lost on me because I was trying like to find where you guys were saying this stuff.
The deterrent to drug use in particular, you mean?
Well, specifically, right? So like at the schools, like you have, like we did this last year, and I remember we passed it, and then I went to the school and there were posters like everywhere that say about, there's no safe experience, and like that, like this should not be relied upon. But I feel like we're going that direction. So is there like deterrence with this, or what is that public deterrent instead of check your drugs? Is there the deterrent factor, like the funding for that part, or is this the trend that they're going to?
I'm not totally sure, but I'll try to answer and then tell me if I misinterpreted. I think that part of the way that we know these services work and harm reduction services in general is that engagement in protecting your health and safety is one step in moving up in other ways of protecting your health and safety, including getting into treatment and recovery. And so in general, we know that engagement with harm reduction services like drug checking and needle exchange lead to 7 times greater entrance. Sorry, it's in the packet somewhere, but lead to 7 times more 7 times greater likelihood that people will engage in treatment and recovery. And part of it is that we now acknowledge that trauma is the gateway to substance use. And that within that, in getting into comprehensive treatment, there's a lot of self-stigma that people who use drugs possess. In making those small steps just with any other chronic condition is really important to get them into treatment. It's not people who engage in drug checking sign into treatment the next day. It's more of a general understanding that's been developed over the last 10 years in addiction medicine.
Okay.
Does that help? Did that get there?
Yeah. Okay. And then what would happen? So if a person were to, if this drug is checked and then it is bad, like, is there any kind of a statistic that says, like, what does a person do in that situation, right? Like, oh, nope, that's bad.
Yeah.
Are they likely to take less?
Yeah.
I don't have an exact statistic, but what happens in many drug checking programs across the US is that usually participants, after they get their result, go into direct counseling with a harm reduction specialist or a public health professional, and they have a conversation about what are the risks of this substance now that you know everything that it's in it. And a lot of folks, when that happens, are able to toss out their drugs because they're not interested in taking xylazine, they're not interested in having benzodiazepines or anything, baby powder in their system, injecting that into themselves. So they're able to really, I just totally lost my train of thought, but
yeah, I think what we know is that we do see that, preliminary numbers have been about 50% of people take measures to reduce their risk based on those conversations that Liz is describing. So they don't use the drug, they use less of the drug, they use in a different way that's less likely to result in overdose wounds, things like that.
Thank you. Thank you for answering my questions. I hope I didn't.
They were great questions.
I tried to learn something there. Representative Paquette?
Hi. Can you just clarify for me who, I guess I'm just not really understanding, who would have this equipment in their hands? Like, who would be who would have this, and how are the people that need this service utilizing it? Like, how are they accessing whoever's using the equipment?
I can try and say that, implementation would definitely have to take a little bit for any kind of drug checking program for the coalition, but it would be public health officials. It would be those who are SSP workers, harm reduction specialists, and most likely we would share this kind of technology the same way that we share how folks can get to an SSP or come and get those harm reduction services through word of mouth, through various advertisements on social media, newspapers, all those things. But it would be targeted at folks who are probably already using the exchanges and participating in harm reduction, because it is something that they ask at every single SSP. How do I know what's in my supply? Because if xylozine's in it, I do not want it.
And I will just say one of the other populations of interest into target is around, we see less engagement in harm reduction services around, like, say, college age youth. But we know that substance use is happening. And so this becomes another tool when people are, buying pressed pills in order to get through finals, which, yes, I can acknowledge we don't want them to do, but they then engage in services that are disconnected from their parents' health insurance, disconnected from their school, that they may face repercussions. It gives them a confidential source to engage with drug checking, and also then to support if they want to get into treatment or they need to get into treatment, or taking other steps to improve their safety.
Okay. Follow up? Sure. Follow up. So we have engagement center. So where I'm at, like, we have a shelter with engagement center. So, and there's harm reduction services there as far as I know. So it would be somebody there that works within harm reduction that would be utilizing that equipment.
May I ask where you are?
Manchester.
Manchester. Yes. So it would be the overdose prevention coordinator. It could be public health officials. It could be something where people are doing, they're already doing HIV and hepatitis C testing in collaboration with harm reduction services. Mobile van, we have mobile vans, I'm not with the organization. They let me hang out with them. So it would be those same services. This wouldn't be a new service. It would just be another tool in currently existing services.
Okay, thank you.
Representative Newman?
It sounds like, reading this, that you do portable drug checking now. Is
No.
that what maybe I misinterpreted?
Yeah,
what you
no,
read.
not in this state. At least the New Hampshire Harm Reduction Coalition or myself as a researcher, we are unable to do that at this time. We just collaborate with a lot of folks in Vermont, Massachusetts that do this, offer this service regularly.
And we do offer test strips.
Oh, yes.
Follow up?
Follow up?
So is that one of the benefits of this bill, that it would allow you to do that without take the liability away? Is that?
Yeah, that's the express purpose. And to be honest, if we could, I think that it's really being able to fund these services, not through state funding, but rather there are federal grants that we are unable to obtain because it is not expressly legal in New Hampshire legislation.
Thank you.
Are there any other questions? We're all set. Thank you very much. Ms. Frey?
Good afternoon. My name is Kate Fry. I'm the Vice President of Advocacy at New Futures. We are in support of HB 226. I don't think I have much more to add because all of my points have been said, but I will leave you with my written testimony as well as a document from the new Network for Public Health Law that really talks about this issue, and it's a survey of other states because we're not alone in this. A lot of other states are looking to address the issue as well, so this will give you an idea of what other states are doing. I do just want to underscore Representative Musa's point. I think one of the main reasons that New Hampshire has been successful as far as like slowing down the overdoses is that we tried a little bit of everything. And we've been involved in things like the Good Samaritan Law, Narcan distribution, and we look at this as one more tool in the toolbox. And although we have an exception for xylazine and fentanyl strips, this is a comprehensive drug checking program, and we really support taking the next steps. Because as we know, the people who put the drug supply out there, they're very smart. Things change all the time. We need to be equipped to be very nimble as well. So I will leave you with my testimony.
Thank you very much. Are there anybody have any questions? We're all set. Looks like we're all set. Thank you. Captain Bright, is it Captain? Major. I knew that. Can I have a do-over? Major Bright.
I'm not big on titles, but my name is Bill Bright. I am a major with the state police. I oversee our investigative services bureau. And I've listened to all the testimony today about this bill. And, as has been said, law enforcement is just as much invested in saving lives as everybody else that has been at this table today. The part of my purpose in being here and part of my job, I think, is to, with my experience, look at a bill like this or a law and try and think, okay, is there a way that something like this could be exploited by somebody that has bad intentions? One thing that I'll just say right now is, as this is written, and I understand that there may be an amendment coming, so there might be, some answers to some of these things. But as this is written, it is very broad. Thinking about page 4 specifically, at the top of the page, line 4, it says a person. I know it's been said that it will be, that this will only be employees of these facilities. But the way this bill is written right now, it does not specify that. It says any person who possesses, transports, delivers, or provides a nominal amount. And I understand that wording may be taken out, but the question still remains is, how does somebody bring an illegal, dangerous narcotic drug somewhere safely in order to get it checked? I don't have that answer. I don't know what the answer is to that. But that is one concern that I have. How does that actually happen? And would they be responsible if they had more than whatever this amount is that seems like should be established? On the flip side of that, if if an employee of the harm reduction site takes in, a small bag from somebody that is more than they need in order to check, like what's the procedure? What's the process for that? Are they disposing of the rest of it? Are they giving it back? I just think that there's a lot of questions that need to be answered in something like this. And it doesn't mean that, we wouldn't be willing to, to work with a committee if one was established, or representatives that are trying to work on this. I certainly can't say that we would support it. As of now, we oppose this bill the way it's written. If you look further down on page 4, sections 4 and 5, we're offering subject to revocation of probation, parole, or pretrial release, subject to civil, disciplinary, or administrative action, subject to the loss of one or more dependents, subject to the loss of housing, or result in any other punitive action or penalty taken against a person. And the only qualifier is that, that they're engaging in any act authorized under this section. And I just think that there's a lot of questions that need to be answered throughout this process, how it actually takes place before you could even consider offering that type of immunity. And who is vetting the people that will be handling the drugs to do the checking. All of those things are questions in my mind, and I believe that they should be questions in the committee's mind if you're considering pushing this through.
Thank you, Major Bright. Representative Scheer.
So I'm curious, exactly, I guess I need more detail about what your concerns are on page 4 on the section entitled "A Person May." What are you worried about if somebody brings with them more drugs than are needed for the testing, and then the testing is done? What's the specific worry you have?
Well, narcotics that we're testing in this case, fentanyl most likely, and it could be a multitude of other drugs, are extremely dangerous narcotics. They cause harm to the people that use them up until death. So that would be my concern, is if there's an excessive amount that's brought in, what's happening to that? Are we giving it back to the person to take back and use? And I think that there's probably some risk and liability in doing that.
What would you have happen? I'm sorry, follow up. I'm not challenging, I'm just...
Representative Scheer, please be very careful just to ask questions and not to challenge the witness.
My question is, what would you have happen in that circumstance?
Well, I certainly don't claim to have all the answers to this problem that we have in the state. My solution would be no tolerance at all. But getting there is, how do we get there? That's the big question. Law enforcement, we do our job that we've been given to enforce the laws that we have established on the books. So when there's a new law, I look at it, how will this affect the community first? How will it affect law enforcement and how we perform that job? So to answer that question, my answer would be is that I wouldn't allow it. I wouldn't allow that to happen. I don't see any place where it would be acceptable for me or anybody else to hand an amount of drugs back to somebody and say, it's okay to use this because it just tested for these substances.
Thank you.
Representative Newman.
Yeah, I just have a question about going on to his question, where it doesn't only say a person may, it starts out with the title that says use of drug checking equipment. So I imagine it would be a person that is using drug checking equipment may. And would that make any difference in what you've said just in the past?
I don't know. Like I say, I'm not an expert on all the wording in this bill. There may be some answers to some of those things. Maybe it doesn't apply. But I just look at this from a law enforcement perspective. And if I read this bill right now, it looks to me like any person may do these things. And it doesn't define that that's an employee of whatever the harm reduction site is, how many employees there are in the state, where those, are located, or if it's just any individual that has drug checking equipment, they're allowed to possess. I don't know the answers to all of that. I just think that it needs to be considered.
Thank you.
Representative Gathright.
I think my question actually needs to go back to, I forget, no, I know. Never mind for you. I don't think you can answer what I want answered right now. And that's bouncing off of something they said.
Representative, do you think that it's something that you could just go ask them?
No, I think it's everybody might want to know. Can they come back after we finish this, please? Thank you.
We'll make exceptions. It's an important bill. Are there any other questions for Major Bright? Right. Seeing none, thank you very much.
Thank you.
Is that all? Is that your deal? And- Do you guys mind coming back up to answer a question? Okay. I don't know if that's a good thing for that scene.
If the committee wishes, I may be able to. If the committee wishes, I might be able to walk through where these amendments hit to explain the conversation that just came up.
Well, I think one thing we have to be very careful of is we generally do not have people come back up and, retestify or do any cleanup, if you will. And in all fairness, that really wouldn't be fair because there's a lot of people that like to do that. But it did sound like Representative Gathright had a question that kind of came up later. So I am making that exception for her. So if we could just please stick to that so that we don't have any problems going down the line with that.
Thank you.
Thank you. Representative Gathright.
Thank you for taking my question. In reading this again, and this piece here about use of drug checking equipment permitted, a person may. As I remember, I thought it was the person that's doing the drugs or purchase the drugs was going to do the testing. I think I heard something different today. That a health provider or someone like that would be doing the testing. So that means that we weren't talking about equipment that the user would be purchasing to test for themselves. I'm just asking.
Yeah, this would be related to a service. So I think the amendment comes to specifically define the scope of drug checking on page 4. That is a follow-up to the bottom of page 3, which amends RSA 318B2 to insert that paragraph related to drug checking. And that specifically states conducted by harm reduction programs registered with the New Hampshire Department of Health and Human Services. So that was a change from prior iterations to address these concerns.
Okay. Thank you very much. I missed that. Yes.
We're not reopening questions up for that. We made an exception for the question. If you could, I think that they're probably more than happy to. Right. Yeah. Thank you very much. Is there anybody here that is wishing to testify that has not turned in a pink card? Right. Seeing none, we will close the public hearing for House Bill 226. And we have one more for this afternoon. Okay. I am opening the public hearing for House Bill 380 and recognize the prime sponsor or a sponsor. If you don't mind, just give a second for settle in. It looks like something's being passed around. Thank you. I apologize. It kind of cut off and didn't have any sponsors here, and I didn't want to call the wrong name.
Good afternoon.
You're all set.
Good afternoon, Chairman Rhodes and honorable members of the Criminal Justice Committee. I'm Representative Suzanne Vale, and I am from Nashua, Ward 3. I am here before you today with House Bill 380, and I'm going to give you some testimony and bullet points. There will be other testimony besides mine. In New Hampshire, a qualifying patient or designated caregiver enrolled in the therapeutic cannabis program who sells cannabis to an unauthorized individual is subject to the following penalties under state law: revocation of their registry identification card, So according to RSA 126X:3, Section 6, if a qualifying parent or caregiver, patient or care is found to have sold cannabis to an unauthorized individual, the New Hampshire Department of Health and Human Services revokes their registry identification card, and the revocation removes the individual's legal authorization to possess and use therapeutic cannabis, and this is under state law. Also, there's a first penalty under the Controlled Drug Act, and under RSA 318-B:26, any individual who sells a controlled drug, including cannabis, without proper authorization is guilty of a Class B felony. A conviction under this provision may result in imprisonment of up to 7 years, a fine of up to $25,000, or both. The second felony is the one that the bill addresses, and that's specific to the therapeutic cannabis program. So according to RSA 315B:26(9)(a), which is an additional section, a therapeutic cannabis program participant, patient, or caregiver who sells cannabis to a non-qualifying individual commits an additional offense classified as an second Class B felony, and the penalties for that offense include imprisonment of up to 7 years and a fine of $300,000, or both. So summarizing the consequences, the revocation of the registry identification card and 2 separate Class B felony charges, each carrying potential prison time of up to 14 years and $325,000 in fines. So the double jeopardy effect is what the bill is trying to address, because patients and caregivers are already subject to general drug distribution laws, and those impose significant and severe penalties for unauthorized sales. One of the arguments I have is that the penalties for unauthorized distribution are severe, and they add another felony specific to the program that might discourage eligible patients from participating due to fear of harsh legal repercussions. Patients are vulnerable, and this is about the patients, and I'm here to advocate for them. Many program participants have chronic illnesses, and this is just not something that's occurring with them. If they were to somehow make a mistake and get caught up in this felony, that kind of time is really expensive. And I don't mean to put a cost on anything, but as you know, I know from working with the Hillsborough County system and working with their budget that the medical cost of having somebody with a chronic condition in the jail is just skyrocketing. And it is an issue when you have people who are nonviolent and they're in a nonviolent type of crime doing time and being not able to get their therapeutic cannabis, they would have difficulty surviving without a number of pharmaceutical medications that are required to manage these conditions in the absence of using the therapeutic cannabis. So to get back on track, patients can already sell and exchange to another patient and caregiver, but this penalty assumes that a person who is in the program is transferring or selling cannabis that is from the program. So an example of circumstances that could happen for the patient is a certified person sells or transfers 2 ounces or less to someone who was formally certified but has recently had an expiration of their certification where the buyer knows they may or not know they need to renew or not. A certified patient can come from another state and doesn't know the full extent of the restrictions in New Hampshire, and I dare say they wouldn't expect things to be as serious with the second felony that's put forth here for the patient. And then I have another example. If a patient gives the cannabis to a friend or family who has previously acted as a caregiver, that's another complication. I just believe that patients don't always know exactly the full extent of the penalties involved. And I personally did not know the full extent of the penalties when I became a patient. And had I been, I just would feel like this kind of scrutiny is excessively harsh, and I would really think about it twice. And to, you know, it's safer to legally take opiates to manage some of these conditions, and we don't want to be able to say that because it's not safer if someone faces up to 14 years in prison and a $325,000 fine. So finally, I just wanted to say that patients are already held accountable. It's very unlikely that someone who has a chronic condition is going to maliciously or deliberately transfer what they have for cannabis. There's a lot of limitations on how much they can possess in the first place, and it is expensive to participate in the program. It's not something that would be at all economical for the person in the program. And then they also lose their access completely and face some pretty stiff penalties. So I may have just said this in the beginning and skipped this lengthy speech, but House Bill 1295 was word for word the same as this bill, and it passed through this committee on a consent calendar. I believe it was unanimous, and it went on the floor and was passed by the House on the consent calendar. So there it was unanimous as well. So I hope that the committee will take another look at this and find that it is acceptable. And I'll take any questions that you may have.
Thank you, Representative. So basically what you're saying is you're okay with the first charge. You don't like the subsequent. Is that like the wrap up of what you were saying?
Yes, and that is a very good synopsis of what I'm saying. It really, to me, it's just, it doesn't happen in other states. Other states, we're talking about a misdemeanor, and those that have, you know, states that have other conditions, such as they have legal cannabis already.
Representative Muse?
Thanks for taking my question. Are you aware of anyone who's been prosecuted under the full extent of the statute?
I am not.
Thank you.
Good. All right. Seeing no further questions, thank you. Hannon?
Hello. Thank you. Joe Hannon, thanks. So I'm in favor of this bill. I do not think it goes far enough, but I think it goes far enough for our purposes today. You've heard that you're being punished twice for something, and it's something that's considered more dangerous than selling something on the street. I mean, someone that's getting an unknown substance that's not tested, come from an illicit dealer, could be laced, could not be, versus something that's a tested product from medical dispensary. I think it's silly that you have that comparison. And also, Article 18 of our Constitution, penalties to be proportioned to offenses, the true design of all punishment. I'm sure most of you know this, but basically, I don't want to read the whole thing, but no wise legislature will affix the same punishment to the crimes of theft, forgery, and the like, for which they do those of murder and treason. You know, we basically have laws in the state for a reason, but if you have a felony for aggravated sexual assault, you know, someone has sex with a 13-year-old, that person is going to have the same penalty 2 times over for selling medical cannabis. That's not proportioned. That's not fair. That's unconstitutional. And I even believe that selling of a medical grade cannabis, now, if someone's selling it to a child, I think obviously there's different circumstances, but say someone is in the medical program and they get caught selling it to someone who isn't in the medical program because they didn't get a card, but wants to, but they're just afraid to get a card. Now, is that person really causing society a problem that New Hampshire deems it necessary to give them an additional second Class B felony? I think it's wrong. Whether you agree with cannabis or not, this has nothing to do with that. This has to do with what's legal and constitutional and what's fair, and I don't think it is. Thank you.
Thank you, Dr. Han. Are there any questions? All set. Looks like you're all set. Thank you. Representative Seibert.
Hi again. Yeah, my name is Christine Seibert. I'm from Manchester, Ward 1, Hillsborough, District 21. I was just wanted to voice my support for this legislation. Truly, I think it seems to me the reason that we made this, the medicinal purposes for cannabis use legal is so we, maybe don't get charged as harshly for it. And so I see this as being equal to having, say, like a mandatory minimum for certain crimes like they've tried to do in the past seem not to work. I definitely see it as a deterrent when a lot of people find this method or this form of, I guess, medication versus taking other dangerous medications such as opioids. That's probably one of the number one reasons it helps them with chronic pain. I think that just throwing people in jail is, especially if they have chronic pain, they've gone through all of the legal ramifications or all the steps that they need, which is very rigorous. It's also difficult, quite honestly, for them to buy the amount to be able to sell that much that would, whatever. But either way, I think that stacking 2 different felony counts on them. There's already, like they said, rigorous, harsh penalties for such a thing. So I believe there's enough barriers in place where this should definitely be a good option. So make everybody happy. Any questions? Sorry, I kind of winged that. I didn't really write anything down. Thank you.
Sorry, the microphone's on now.
Good afternoon, and once again, thank you for listening to me. Also, I would like to let you know that former Representative Knurk sends his best, but unfortunately he could not be here. He did, however, want me to hand in some written testimony from himself. And as for the record, my name is Heather Marie Brown. I am the alternate chair on the New Hampshire Therapeutic Cannabis Medical Oversight Board. I serve as the patient representative, so it is literally my job to represent the 15,000 plus patients in this state. And I try to do the best job I possibly can. Quite frankly, I will tell you that in my opinion, that little section of the therapeutic cannabis law is literally the exact definition of what discrimination is. The definition of discrimination is unjust or prejudicial treatment of different categories of people, especially on the grounds of ethnicity, sorry about that, age, sex, or disability. Therapeutic cannabis patients are all individuals that have some kind of condition, disability, or qualifying factor. Therefore, that little piece of the law literally discriminates. It not only provides a harsher punishment for a person who is a therapeutic cannabis patient, but it completely puts them into a category where they suffer discrimination. I do work with people that are not patients as well, but that would like to be patients. And I can tell you that one little section of the law, even though they have absolutely no intentions of violating it whatsoever, is what keeps them from getting a therapeutic cannabis card and still seeking out ulterior incentives and ways to take care of their own health. And a lot of it is fear, because it then creates fear. Well, if they can do this, if I sell my cannabis, well, what can they do if they catch me smoking with somebody? Or what can they do if they catch me exchanging with another patient? Or what can they do? And it adds another layer of fear to the whole equation. And I don't think that's right. And I don't really believe that that's the kind of message that New Hampshire wants to send to some of the most weak and vulnerable individuals that they have. I also would like to tell you that therapeutic cannabis is entirely way too expensive for someone to have any interest whatsoever in selling it to another human being. It just would not be feasible or plausible or make any sense whatsoever. So I believe that at the time that this law was written and that, that was put in there, that there was fear around the fact that cannabis wasn't as readily available as what it is now. Now, you can get it from the streets. You can get it from Maine, Vermont, Massachusetts. I can drive 30 minutes from my house, cross the borders, and there are 8 stores within a 6-mile radius of one another. So I think that section of the law is really entirely outdated. And, again, as I said, it's also discriminative. And I believe that it's time for it to be removed. And I believe that it's time for us to take away that aspect of fear from a wonderful program. So thank you very much. If you have any questions.
None? Seeing none, thank you very much.
Thank you.
Mr. Simon.
Thank you, Madam Chair. One more time for the record, Matt Simon, Granite Leaf Cannabis. We do support this bill. A long time ago, from 2009 to 2013, I had the privilege of being one of the leaders in the fight to pass the therapeutic cannabis law. The biggest concern that we heard in this legislature throughout that process from opponents and skeptics was the fear of diversion. There were some opponents who tried to paint a picture that all of these patients were really just seeking cannabis for recreational use, and that they were fundamentally immoral people who would want to purchase cannabis from the dispensaries and then sell it on the playground or to their friends. And there was a lot of that talk a long time ago. So in response to those talking points, I repeatedly pointed out that selling cannabis or even dispensing it without sale is already a felony in New Hampshire. It's clearly spelled out in RSA 318B. And that is a pretty big detriment or deterrent that something is a felony. And we don't need more than that. That was enough. Unfortunately, in order to get the law passed in 2013, we had to concede on that point and add this extra felony to RSA 126X. So it is just that, an extra felony. Without that felony, I would argue that police and prosecutors have plenty of authority to prosecute anybody who sells or dispenses marijuana, as it's called in RSA 318B, to an unauthorized person. So we do not need this redundant extra felony in RSA 126X. And I do think it is a deterrent to participation in the program, because when patients fill out the paperwork for the program, they have to sign a statement that they know about this extra felony and that they're setting themselves up for this extra potential scrutiny. So I hope this will be the year that the extra felony goes away. Happy to take any questions.
Thank you very much. Do we have any questions? Looks like you're all set. Thank you very much.
Thank you.
Michael Holt.
Thank you very much, Madam Chair. I'm passing around information that you likely already have. It's a snip of the criminal penalties for the sale of cannabis, just for reference. For the record, my name is Michael Holt. I'm the administrator of the Therapeutic Cannabis Program with the Department of Health and Human Services. I'm here today to support House Bill 380. A lot of my testimony will be similar to what you've heard already, but if I would like to proceed. House Bill 380 proposes to remove an enhanced penalty for the sale of cannabis by a registered patient or caregiver to someone who is not authorized to possess, basically to a person who's not a registered patient or caregiver. As you may know, and what I've just passed out, New Hampshire penalties established in 318B26 for a person convicted of selling cannabis are based on the amount of cannabis. So less than 1 ounce, the penalty is 3 years in prison, a $25,000 fine. 1 ounce or more is 7 years in prison or a $100,000 fine. 5 pounds or more is 20 years in prison and a $300,000 fine. If a registered patient or designated caregiver is convicted of selling cannabis in any amount, they are subject to an additional penalty. They are subject to the penalties that I've just listed and an additional Class B felony with the following additional penalties: 7 years in prison, $300,000 fine. So the legislative intent for this extra penalty perhaps made some sense in 2013 when the therapeutic cannabis law was first passed. At that time, there were no legal means for adults to purchase cannabis outside a state medical program. No state, at least in the Northeast, had legalized cannabis for adult use. Colorado and Washington had legalized it in 2012. So in 2013, medical access to cannabis was believed to be a primary source and cause of diversion. The concern that patients would purchase it legally from their medical dispensary and sell it to recreational users at a profit. At that time, pricing of medical cannabis was intentionally set at black market prices to discourage diversion. And in 2013, access to therapeutic cannabis in New Hampshire came with great responsibility. Not to divert it. And it was believed at the time of writing that an enhanced penalty would do the trick to deter any potential diversion. Fast forward to 2025, the situation is very different. Cannabis is legally sold everywhere in New England, except New Hampshire and Pennsylvania. In terms of the Northeast, New Hampshire adults have easy access to legal cannabis with a short drive across state borders in any direction. And as you know, cannabis brought back into New Hampshire, legally bought in another state, has been decriminalized up to an amount of 3/4 of an ounce. Because of this regional legal access, the risk of diversion for profit from therapeutic cannabis patients has been greatly reduced. Some might argue it is practically non-existent. Medical patients no longer have special access to cannabis, and as has been testified, diversion by patients doesn't make any financial sense because adult use recreational cannabis sold in other states costs less than therapeutic cannabis costs here in New Hampshire. There's no financial incentive to divert. So to be clear, selling cannabis is a crime. It's still a crime. It would still be a crime after this bill passes, if this bill passes, for everyone in New Hampshire. The penalties in 318B26 would remain. This is an old law. It's no longer necessary. Registered patients who happen to make a poor life choice or a mistake and are caught and convicted of selling cannabis to someone not authorized to possess it should be treated the same as someone who's not a registered patient. I want to thank you for the opportunity to testify, and I'm happy to take any questions.
You're welcome. Thank you for coming in today. Are there any questions? Looks like you're all set. Thank you very much.
Thank you.
Is there anybody else here that would wish to testify on House Bill 380 that has not turned in a paint card? Seeing none, close the public hearing, and that is concludes our business for today. And I will see you all tomorrow morning.